AI agent. This project addresses the pressing need for comprehensive menstrual health support, particularly given the rise of self-funded employee health plans. These plans, covering over 160 million Americans, represent a $1.5 trillion dollar industry, yet many employees struggle to utilize their benefits due to administrative complexities and lack of awareness. Our platform aims to bridge this gap by seamlessly integrating with employer systems, simplifying administrative processes, and offering personalized health recommendations. With user-friendly interfaces and virtual payment options, Sanicle AI removes barriers to access and empowers employees to efficiently utilize their health benefits. From June to December, we are focused on several key milestones. We are finalizing our MVP, developing our website, and actively pursuing SBIR grants to support our initiatives. Collaboration with all stakeholders is crucial, and we are committed to working closely with employers, healthcare providers, and policymakers to create a supportive ecosystem for menstrual health. We invite you to join us with your 3 T's: talent, treasure, and time. Your expertise, financial support, and dedication can help scale Sanicle to serve government, corporate, and nonprofit employers effectively. Today's event is a pivotal moment for us. It provides an opportunity to showcase our progress, gather feedback, and build lasting partnerships. We hope to accomplish several objectives, including raising awareness about our mission, fostering collaboration among stakeholders, and driving forward the conversation on menstrual health in the workplace. Before we begin this amazing summit, I'd like to personally thank our wonderful contributors, speakers, and people working behind the scenes to make this happen. We have come from all over the world, including Poland, the Democratic Republic of the Congo, India, Sierra Leone, and here in the United States of America, to create a global consciousness of this very important issue. We appreciate all of your hard work. Our speakers' expertise spans various fields, including healthcare, technology, and corporate wellness. Each speaker brings a unique perspective and invaluable insights that will enrich our discussions today. Their participation underscores the global commitment to improving menstrual health and workplace wellness, and we are incredibly grateful for all their contributions. And finally, to kick us off, I'd like to introduce our Chief Period Officer at Sanicle, Chase Enagbedion. You will hear more from him later as well, but Chase is the one who is responsible for me being here today, beginning almost a year ago when he gifted me a copy of his book, The Period Passport. Chase is an emblem of innovation, social and entrepreneurship, and women's health advocacy. His journey from Nigeria to global health innovation epitomizes relentless pursuit, transformative leadership, and unwavering societal commitment. Please help me welcome Chase.
Thank you so much, Michelle. And it's been a long time coming, just like we're celebrating a decade of celebration for the International Menstruation Day. And I thank everyone that's participated and still participating and who is joining us today. This is so exciting. My remark will be quick, and I have it written so we can go right to it. So the topic of my opening remarks today is a decade of period work. We will soon be able to fix periods. This year marks the 10th anniversary of Menstrual Hygiene Day, a decade-long journey of campaigning and advocacy aimed at transforming how the world perceived menstruation. Over the past 10 years, significant strides have been made in breaking down the stigma and taboos surrounding menstruation, but the mission is far from complete. The evolution of AI in menstrual health, as we tag the theme of today's event, is highlighting the intersection of AI and menstrual health, where innovative technologies are forged between employers and employees in the workplace. We have crafted our topics today to reflect our major audience from government, corporate, and nonprofit employers. I can see Rep. Suzanne on the call, and also my Queen Mother Hawa Diallo from the United Nations. Recently, I've had the privilege of speaking at the UN Civil Society Conference, thanks to Hawa Diallo, emphasizing the critical importance of menstrual health. Our speakers, like our host have mentioned, have gathered internationally from countries such as Poland, Kenya, the United Kingdom, India, and more. The journey so far. For me, my journey with MHD, which is the Menstrual Hygiene Day, began in 2016 on the streets of Lagos and have taken me to the chamber rooms of the United Nations and various global conferences discussing period poverty. From Stockholm, Sweden to Morocco, South Korea, South Africa, Kenya, the United Kingdom, and Japan, the campaign has gained global momentum. Sanicle has also gained recognition for our efforts, including hosting the event last year with the Oklahoma Legislative Black Caucus, and hosting significant events like Women of Wakanda, Martin Luther King's Day inaugural Dream on First, International Women's Day, International Day of the Girl Child STEM Sheroes, and the Period Passport Tour at Southern Utah University. We have also recently been selected for the Google Cloud Rise Summit in Atlanta and the lightning rounds at the Generator Earth Conference, opening doors for more partnership and funding. There's a quote I remember: "Anything you can do, I can do bleeding." This popular slogan, popularized by Senator Gloria Obo's campaign in Kenya, encapsulates the spirit of the movement. Last year, the senator made headlines when she was expelled from a parliamentary session for attending with a visible blood stain on her trousers, a bold statement against period shaming. Despite the criticism, our actions highlighted the daily challenges faced by millions of women and girls who menstruate. A global movement. Menstrual Hygiene Day, which is observed on May 28th, unites nonprofits, the government, the private sectors, and individuals in a shared mission to create a period-friendly world. This vision includes eradicating the stigma and taboos surrounding menstruation and ensuring access to quality menstrual products, education, and facilities for all. Beyond being just an awareness day, MHD has grown into a movement advocating for sustainable and inclusive solutions. Addressing the challenges. Every month, over 2 billion people menstruate worldwide. Despite being a natural and healthy process, menstruation often disrupts the lives of millions due to lack of access to menstrual products, sanitation, and hygiene facilities. Additionally, many women and girls lack the education and awareness necessary to manage their menstrual health effectively. Today's workforce, especially millennials, prioritize corporate values that align with their personal beliefs. Companies that implement progressive policies such as menstrual leave not only support their employees, but also retain top talent. The cost of recruiting, hiring, onboarding, and training new employees is high, and retaining employees through supportive policies can save companies substantial amounts of money. For women suffering from severe menstrual pain caused by conditions like endometriosis, productivity at work can be significantly hindered. Progressive menstrual policies that acknowledge and support these challenges can improve employee satisfaction and reduce turnover. Employers who demonstrate empathy towards menstrual disorders create a more inclusive and supportive work environment, fostering loyalty and better retention in the long run. Real stories and real impact. At a recent conference, I encountered Mary, not real name, a woman visibly distressed due to unexpectedly starting a period without access to menstrual products. Her courage in voicing her needs highlighted the ongoing struggles many face. By providing her with the necessary product, I witnessed firsthand the profound impact of support and understanding in such situations. This experience underscored the importance of accessible menstrual products and the need for continued advocacy. What's the future in fixing periods? As we look to the future, the question arises, will we soon be able to fix periods? Advances in technology and healthcare are promising. Innovation in menstrual products, increased awareness, and supportive workplace policies are steps towards a more period-friendly world. However, fixing period goes beyond just medical solutions. It requires societal change. And I'm sure the rep, Suzanne, will share more on that. Creating a world where menstruation is not a source of shame or disadvantage is crucial. This involves continuous education, advocacy, and the implementation of inclusive policies. By fostering a supportive environment, we can empower individuals to manage their menstrual health with dignity and respect. Menstrual Hygiene Day 10th anniversary symbolizes a decade of progress, yet it also serves as a reminder of the work that still needs to be done. The journey towards a period-friendly world continues, driven by the collective efforts of individuals, organizations, and government. And we can only thank you, our speakers, our panels, and our hosts, and the organizers of this event making this possible. As we strive to fix period, let us remember that the goal is not just to address the physical aspect, but to create a society where menstruation is normalized and everyone has the resources and support they need. Together, we can build a future where periods are no longer a barrier, but a natural part of life. For the men in the room, I thank you for joining us, and I want you to continue the conversation. Thank you.
Thank you so very much, Chase. Sorry about that, everyone. We will play that video a little bit later on today. Now, I would like to introduce our keynote speaker. It is Oklahoma State Representative Suzanne Schreiber. Earlier this year, Representative Schreiber sponsored a bill that was signed into law, making patient mammography reports plain and easy to understand. This work and many other initiatives she has undertaken as state representative for District 70 showcases her belief in helping our communities thrive, putting people over politics to solve real problems, allowing our families and state to grow and thrive. She holds a law degree from the University of Tulsa, as well as a Bachelor of Science in Political Science and Law and Society. She has served on the Tulsa Public School Board, Oklahoma Watch, and Oklahoma Hall of Fame. We are so grateful that she is with us and honored for her to deliver our keynote. Please welcome Representative Suzanne Schreiber.
There we go. Thank you all for having me. I'm excited to be here and so impressed with this work. It's amazing. And obviously, as a woman, as a mother, having been a teen, having teenagers, being in the workplace with other women, and everything I do in life, this is a part of who we are. And so making it normalized and a part of our daily life and supporting women in their menstrual cycle is so important. Today, I'm going to talk a little bit about me, and then so you'll get to know me and have a little perspective on me, and then talk about some of my legislative work in my first 2 years in the Oklahoma legislature. I am a native of the state of New Mexico, grew up there, and came to Tulsa, Oklahoma to go to college, went to undergraduate for political science, and then took a year off, worked on campaigns, went to law school. Got out of law school, worked in some law firms and in the United States federal court for several years, and then went to work for a foundation here in Tulsa. And not long after that, found myself running for the for the local school board And I did that for 8 years, and it was a great training ground for leadership and learning how to compromise, learning how to build consensus, and making some really hard decisions in a very high pressure local kind of way, because you have to see those people the next morning at school when you drop your kids off, when you've made that decision that's going to be affecting them. So it was a really honor to be a part of that. And then I decided to run for the Oklahoma legislature, and I've been there for 2 years. And two chief things that I am working on, you mentioned the mammography bill, and it was an important bill. It communicates when you receive a mammography report, you may have a certain type of breast tissue called dense breast tissue, and that may require some follow-up and it may not. But the notice on the report that you get and the language on there is very important for patients so they can decide how to make their next decisions, whether they want to call their doctor, whether they want to make another appointment, what they should do. And so communicating that in a sentence in just one report is very important. So the language that is sent to patients needs to be right. The federal government had been working on that. The state government had been working on it. And we blended those to make sure that the federal law was complied with, but in a very plain language way. So Oklahoma women, when they receive their mammography report, can call their doctor if they want to, but also not feel panicked or alarmed or scared. So that was something that we did this year that came to me from actually a radiologist doctor who was concerned about that, and we ran legislation. So that was an important thing that we got done. The other thing that we've worked on a lot this year and was just signed into law last week is medical debt. So 25% of Oklahomans have medical debt, and it is the number one reason Oklahomans declare bankruptcy. And it's not just for those who are uninsured. Many Oklahomans and people all around the United States have a very high deductible on their insurance. So effectively, they're paying cash. So if you have a $5,000, $7,000, $10,000 deductible, even a $2,000 deductible, that's a lot of cash out of your pocket that you have to pay before you hit that deductible. So you need to know what routine medical things cost so you can make decisions and shop that just like you would any other service, something for your car, a legal service, an accounting service, a sandwich. You need to know what those things cost so that you can make a decision about how much you're going to spend and not end up saddled with more debt than you need. And so we have a bill that was signed by the governor this year that requires medical providers to follow both state and federal law and share with you their top 20 costs. If it's a hospital, it has to be their top 100 costs. So the most used things. And if you go to a physical therapist or if you go to a primary care provider, they need to be having posted in their office annually the top 20 things that they provide and what those costs are so that you can make a decision about that and are not saddled with more debt than you should be. And we're going to continue to be working on that because that's a huge issue for everyone, how they navigate sustainability and wealth in the face of American medical costs. And so price transparency is very, very important. And my slogan is people over politics, but the slogan for kind of the movement around the medical price transparency is patience over politics. So it flanges well with the work that I do. And then my chief thing that I work on that relates to your work is definitely childcare. So this is a place where 95% of the employees, the childcare owners, the people that are making decisions about childcare are women. And I've run several bills on this that focus on not just the families and needing childcare. For a long time, the focus in childcare was really around the quality of childcare and the regulations about driving what you're getting in a childcare setting and knowing that your children are safe. And that's very, very important. And Oklahoma has done a lot of work in that area. But what we're forgetting is sort of the business of childcare and how our childcare owners and providers can be paid the wages that they deserve and also be able to take care of our children and have the capacity that they need to take care of our kids. So last year, I ran a bill that kind of cut some red tape for childcare owners and small providers. So in Oklahoma and many states, there's a huge issue with lack of affordable and accessible childcare. And that can mean a couple of things when I say accessible. It might mean that it's not close to your work. It might mean that there's no spots. That's very common in Oklahoma. There's 3 children for every 1 spot available. So we have a huge lack of childcare. And it might mean that they don't have the hours that you need for your job. So it might mean that the childcare runs from 9 to 4 and you start work at 6:30. You need to drop your kids off at 6:30. You need to stay into the evening. So there's just a lot of things when we talk about accessibility that go into that. And then affordability is pretty basic. An infant in Oklahoma, if you are not receiving any subsidy from the state, costs more than a year in college to take care of a baby at a childcare for that family. If you receive subsidy, then it will be less, but it's still quite a bit and the subsidy cutoff is a $50,000 or less is when you start qualifying for some support from the state. And if you make $50,100, you're right there at that $1,200 a month. So it's in a very, very, very costly thing for a family, and one of the number one things that families actually need and pay for. And our workforce desperately needs it to be working because we have a very large portion of Oklahoma's workforce and the nation's workforce out of the workforce solely because of childcare. About 1/3 of the eligible workers in Oklahoma are not working because they cannot afford or find or both childcare. And of the 1/3 of those, 90% of those are women. So we very much need for these women to be able to figure out their childcare needs so that they can go back to work. So last year, in our two types of childcare, we have a center-based childcare, which is large, and then in the smaller childcare, we have home-based childcare. Most of those are in communities of, rural communities of color. That is something that is very much needed. And there was a lot of regulations on those preventing those from being going concerns because they had a lot of regulations. So we were able to cut some red tape for them last year and create accessibility for that. And this year we have 2 childcare bills that are very important to creating this affordability and accessibility. One thing that needs to be understood about accessibility is that when our childcare, it's not really about a building. So if you think, accessibility, there's not spots, you think about a building. Don't think about a building. Think about the people, the woman who isn't able to go to work for whatever reason. She doesn't have childcare. It's not affordable, but she cannot get there. And maybe it's an issue around menstrual health and there's not policies in place for that, or she's not taken care of in that way, whatever it is. If she is a childcare worker and she is not there, you are losing spots every single time. So those folks are not, it's about the ratios of children. It's not about really a building or a space. So that is kind of how you have to think about it. So when we run my objective is to encourage those employees to come back to work. How can they do that? And that is done by a couple of things. Obviously, it's a very low paying field. It's $11.67 an hour. You can work a lot of places for a lot more than that. And we're paying these people are supposed to be taking care of our most vulnerable and precious asset, our children. So trying to figure out how to drive more funds to these kids, to these licensed childcare providers is very, very important. So I have a bill that relates to that. I also have a bill that sends providers, it if an employer of any kind, Quick Trip, Papa John's, a law firm, whoever wants to share in costs with their employees, so they would say, I'm going to give you $100 added on your paycheck per month, you would be able to the employer would get a tax credit for that, but they're sharing in the cost with their employee. What that does is help their employee find childcare more affordable. And then once we're able to drive more people back into the workforce with that, or keep them in the workforce, lots of times we lose someone when they have a baby, they leave the workforce and then they decide, oh my gosh, I can't afford to go back to work, it's too expensive, and then that employer loses them. So the idea behind that is to help employees with the cost of childcare, and it gives the employer a tax credit. So that's an incentive around that. Then the final bill that I have that I've been working on is in Oklahoma during the COVID recovery period, when the federal government was sharing a lot of money all around the United States. Many states decided to use some of their money to allow childcare employees to have free childcare. So we actually offer these subsidies right now to anyone who has $50,000 or left, kind of on a graded scale. But we said nobody has to income qualify. If you are working in a licensed childcare, the state is going to pick up the cost for that. Okay. If you think about it, many of those people are already qualifying for that, because if they're making $11.67 an hour on average, they're probably qualifying for that free care. My bill was just to continue that. And then if there's anybody that makes $50,100 or $100,000 by their family or something like that for some reason, they could also get that benefit. And that's an incentive to the workforce to get childcare workers in place, and just telling them, as long as you are working in a licensed childcare, your own children, you will never have to pay for them to go to any childcare they want. They don't have to necessarily go to the one that you work at. So that bill is about an $18 million price tag. I think it's kind of overestimated, but that's what it would cost the state of Oklahoma to do that. The state of Kentucky has done it. The state of Tennessee has done it, and continued putting taxpayer dollars toward that. And one of the reasons that I feel like that is so important is not just because families and women especially are affected and they want to work. And so offering these benefits to a childcare employee, again, opens up many slots. And when we drive down and when we create more accessibility, that always affects cost, right? So your basic economics of that, we want for those things to, we want to incentivize those workers in every single way that we can, but it's a very women focused impact. So when we think about these things, there's all kinds of things that we can do to improve our workplace. And these are tax credits, different kinds of incentives, red tape. Those are the kinds of things that can translate to when we're trying to think about menstrual health, menstrual policy. We can always use these ideas for that, but we also need to make sure that, we're working on some very basic focused things that are kind of a family's need. So if you think about it from day to day, I try to think about, what does a family need to take care of itself? They need affordable health care. They need to not be saddled with medical debt. And many, many people do not have the choice of staying home with their children. If they want to work, if they need to work, they need to have childcare. And the state of Oklahoma needs to build a strong structure for them to be able to do that. So using the government and policy to influence all of that is kind of how I try to shape my thoughts when I'm trying to advocate and push for bills. And I would say my style is very focused on actually using policy to drive down and bear down on very specific things. I have a lot of colleagues on both sides of the aisle that they want to drive accountability from, leaders for larger issues. They focus on other specific issues. I would just say not everyone is very focused on, okay, let's get this bill, let's use this. They might be shaping government and leadership in other ways. And it's good to have all different kinds, but mine is very much through what kind of issue do you have? Let's look at the laws that we have in place. Let's evaluate what changing the law would do. I mean, that's a very important lesson from leadership. And I learned this on the school board, and I've learned it in my first 2 years at the legislature. You can pass a law, or you can pass a regulation, or you can implement a rule at a school board or at a city council or anywhere, but the implementation and the funding and the actual making it happen on a day-to-day basis is actually quite a bit more challenging than that. So you have to make sure that when you create a policy, you understand who are the implementers, how can they implement it, is that something even realistic? So I'll give the example of my child care bill last year. Many cities trying to regulate these home child cares and saying, like, you have to have a fence, or you can't have it in a neighborhood, or you can only have one in a neighborhood, or you have to have all these different little regulations around what they wanted for a neighborhood home child care. Whereas the main goal in these home child cares is inspected and determined by the state of Oklahoma, which is this a safe place? Is there ingress and egress? Is the water good? Is the air quality good? Can a kid run out of the yard and become unsafe quickly? That is a very rigorous process for them to be licensed for that. So we look at the local policy and say, why are you involved in this? You are used to doing zoning and regulations. Is the water good? Is the air quality good? Why are you getting involved in run out of the yard and become unsafe quickly? That is a very rigorous process for them to be licensed for that. Small business owner who has very thin margins for child care is already been deeply inspected, gone through a rigorous licensing process to make sure children are safe. What is the balance between that and a city deciding how they're going to overlay additional regulations? And so when we're evaluating that bill, I have to understand, well, if we say that the city can't do this to a child daycare, does that mean a city can't do it to a massage parlor in that neighborhood? Or if somebody wants to open a sandwich shop in that neighborhood, am I like overreaching by eliminating this red tape? Evaluating all of those things at once and making sure that when we create policy, we know how it can be implemented. We know how people can be taken care of. So that is my couple of ideas around policy. So when you're thinking about creating policy around menstrual health, I would encourage you to think about these things. Also thinking about it holistically, right? All these policies are very family friendly that I'm working on, and they're obviously heavily impacting women, just like almost all policy does. I think that's forgotten quite a bit, that who's going to get impacted by what. But I'm so happy to be here. I don't remember if we have time for questions. I'm happy to take some if anyone has them. I can't read the chat while I'm talking. So if there are questions, I'm happy to answer them, or you're welcome to connect with me afterwards. I'm happy for the Sanicle team to share my contact information through the state of Oklahoma. And if there's anything else, I'm happy to do it, but I'm so honored that you guys asked me, and I hope this was helpful.
Thank you so very much, Representative Schreiber. I am very grateful personally that you are present and working hard for us at the Oklahoma Capitol. Next on our agenda is Hawa Diallo. Ms. Hawa Taylor Kamar Diallo, aka Auntie Hawa, is the chief of the Civil Society unit at the Civil Society and Advocacy section in the UN Department of Global Communications. She has extensive United Nations field and headquarters experience in public information outreach and fostering civil society partnerships, particularly for youth and women's organizations. Ms. Diallo is a national of Sierra Leone in the United States of America. Let's please welcome Hawa Diallo.
Please unmute. Please unmute.
Thank you. I think I'm muted now. It was saying that the host was not allowing me to unmute. I'm always causing trouble wherever I go. But thanks so much for inviting me to this really awesome platform. I really enjoyed listening to what I've heard so far. Personally, for me, it's important to hear these issues that we're talking about. As was mentioned, I'm with United Nations and have been with UN for about 38 years, working in various capacities. And currently, the work I do now is focused on strengthening that engagement with the United Nations and civil society, especially with women's groups and with youth-led organizations. So the topic at hand today is of really dear to my heart, but also personally, my story following the Honorable. I am an African woman and Black woman from Sierra Leone, as was stated, a country on the west coast of Africa, a developing nation, a country that has a lot of cultural and traditional rules and regulations, some good practices, and sometimes some cultural practices that are harmful. And really, one thing I always think about as an African woman is that being born a woman, even before coming out of my mom's stomach, I was already disadvantaged in many ways. I come from a family of 4 brothers, and I am the only girl. And yes, I am the queen, but as a queen, even in the African context, there are lots of things that we struggle with. When I think about my personal story, I'm someone who started menstruating at a very early age. As a matter of fact, my father passed away when I was 10. I just turned 10. And not too soon after that, I remember seeing my period. I could have been 11. I don't really remember because these are things that I don't know what happens now. I turned 60 3 months ago. But at the time I was growing up, menstruation, periods, that's something you just don't talk about. Even though I had lived in the United States for, many years, well, not many years, for the few years of my life before I turned 10, it's not a conversation that I had with my mom, although my mom had been exposed. But I do remember as a 10 or 11-year-old, maybe going to my mom. I don't remember the conversation because it wasn't a deep heart-to-heart conversation. And she could have explained some things to me, which I really would not remember. All I know is that I experienced menstruation at an early age, and it's something that I carried on for, many years. So for me, it's quite interesting when I hear this discussion on menstrual health and hygiene being embraced by both men and women. So thank you for my slides, but I was inspired by the Honorable in telling my personal story. And I think many things that are my slides, I think my son Chase has touched upon already. At some point, I'll zoom in on what the UN is doing. But just to continue with my personal story, I'm saying it's heartwarming and makes me feel good that both men and women, young boys and girls can talk about women's health and really zoom in on something like menstruation and health hygiene and period poverty. That's something that did not happen when I was growing up. And even in the context of Africa, I speak in that context as that's what I know, that it's not an easy conversation to have. So I want to commend Chase, for really bringing this topic to the forefront. I remember when he first came to talk to me about menstrual hygiene and period poverty, I have to say that I was like, what? You're working on what? But then at the same time, as an African, I was so inspired to see a young African male embracing women's issues and women's rights. So I applaud him for that. Having worked in the United Nations, I mean, it's so vast and there's so many UN agencies and programs. I mentioned I work in comms myself, But there's specific UN entities, UN Women, UNFPA for population activities that deal a lot with issues that really impact women in so many ways, whether it's economically, socially, but also in the health aspect. So within the UN itself, many UN entities have implemented and designed on the ground projects that would really, I guess, improve the way women's conditions are on the ground. But I think what I have learned being at the UN is it takes a village, as they say. It takes a consortium of different stakeholders to push these types of issues. So not only the United Nations itself, being UNICEF, talking about young girls and their health issues and sanitation, or UN Women, as I mentioned, or UNFPA, but it takes also government as well, as the Honorable is mentioning, the fact of enacting policies, not only at the international level, but also at the local and community level. It takes the family, it takes action, awareness. It takes, I don't know how you say that, in families, a type of situation where both boys and girls are treated equally, that there's that awareness at home in terms of the rights of the child, be it male or female. So in addition to that, I think the role of organizations like Sanicle, whether it's private sector or civil society organizations, is quite important. Because when I look at some of the frameworks that are happening now at the UN, the most important one is the Summit of the Future, which is coming up in September. And this is have come out of the fact that the UN has been working on the Sustainable Development Goals for many years, and we're more than halfway to that mark. Achievement is supposed to be in 2030, and we're doing better in some places and doing worse in some places. And when it comes to women's issues, I think a lot of strides have been made, but on the local level, a lot still needs to be done. You have the UN enacting all these global strategies and treaties, but then you need to find a way for them to be implemented at the local level through legislature. And that's where I think civil society comes in. But I mentioned this because I said we have the Summit of the Future coming up in September, 22 and 23 September in New York City. And one of the things they'll be doing is to have a pact for the summit, and there'll be a pact for future generations. And they don't mention women. There's no gender equality there. And to me, this is something that's concerning as an individual, as an African, even as a UN staff member, because we've already heard one of the two other speakers say things that we know. Women and young girls are crucial to society. They play a central role, have a significant role at all levels of society, within the home. And if women's health issues are not addressed, economic empowerment, education is also impacted. So for me, it's concerning that a landmark or milestone discussion or agreement that's going to be made at the UN simply does not talk about gender or gender equality. I have not seen menstrual hygiene or menstrual or women's health in that document. So that's, for me, something where I would urge civil society or the legislators at all levels to have that push, because I don't see how policies or any can be implemented if you don't take the concerns of women, especially their health issues. So for me, as I said, it's important to have this type of discussion in terms of looking to see how we can push this topic further. For me, the job that I do in communications, I would love to see, communications and advocacy around period stigma and period education. I know that specific UN entities, like I mentioned before, like UNFPA, would have that. But why not across the UN system? Why only UNICEF and why only UNFPA? I work for the Department of Global Communications. It would be interesting to have, an active campaign in maybe involving young people, young women and girls in terms of educating us about period poverty. I have to be honest. Although I work at the United Nations, I've had to learn myself what is period poverty and what my role would be as a UN official or as an individual in making some impact in this area. I will retire from the UN in a couple of days, and these are things that I'm thinking about. The experience that I have gotten in the UN, how I would be able to take that and to really, champion period poverty or access to menstrual products at the local level, not only in Sierra Leone, but across the continent, collaborating with other, major civil society organizations and multilateral organizations to make sure that young women and girls have access to menstrual products. I have been fortunate. I have been lucky to have access to these type of things, but I can look back or to the side of people who are in my family just because of access who may not be in the same position. That's my personal story, and that's from the point, that I'm speaking from. I'm happy to be here to learn from everybody else and to really offer, my services in a volunteer way moving forward to see how we can collaborate in terms of really pushing the issue of women's health, not only at the United Nations, but within our communities and our families. I think I've said too much already. I want to thank Chase and the Sanicle team for really bringing this topic again to the forefront and, helping us to push this issue also towards a more effective commitment from multilateral organizations like the UN towards ending period poverty. So happy World Menstrual Hygiene Day, which will be on the 28th. That's one thing we've got in right in the UN in terms of having that advocacy and that awareness, which I think may go a very long way. Thank you so much. Over to you, distinguished moderator. Thank you.
Thank you so much. Accessibility is such a major part of what I am concerned with, and you've definitely given me some more considerations to keep top of mind. Let's do some quick trivia really quickly. For our historical context question, who knows what year the International Menstrual Hygiene Day was first celebrated? We've got some answers coming in. I don't know if you can see the poll pop up. The answer is 2014. So we are the 10th anniversary of that. We'll do one more. Let's do a health and knowledge. What is the average duration of a menstrual cycle? 7 days, 28 days, or 2 weeks? The answer is actually 28 days. All right, let's move on. We are going to introduce our next speaker, who is somebody I am very thrilled to introduce. Oklahoma State Representative Monroe Nichols was one of the very first people who made me feel comfortable and welcome in political party spaces, and is therefore partly responsible for me being where I am today. As the first African American elected to represent House District 72, Representative Nichols authored legislation focused on high quality education, accessible healthcare services, neighborhood revitalization, and more. He co-founded Impact Tulsa, has served on the Tulsa Tech Board of Education, and is the Director of Policy and Partnerships for Strive Together. Today, Representative Nichols is campaigning to become Tulsa, Oklahoma's 41st mayor. If elected, he would bring his broad experience and data-driven approach to expand Tulsa's economy, address the affordable housing crisis, and end homelessness, and make Tulsa the safest big city in the United States of America. Please join me in welcoming my friend, Representative Monroe Nichols.
There we go. I am unmuted and I am here. Well, thank you, Michelle, so much for that introduction. The most special part of it is what you said at the top of it. And so thank you for what you do every day, your advocacy, your work here, for example, is just one of the many examples of all the wonderful things you're doing in our community. So I really appreciate you for that. For sure. Hey, everybody, I am State Representative Monroe Nichols. And as she said, in addition to my time in the legislature, I'm campaigning for mayor. But I really want to start by thanking the Sanicle team and everybody who's here for joining in on this really important conversation. And before I dive too deep in any comments, I always like to make sure I ground a conversation I'm having in data. And what our local data tells us is that we have a huge gap in equity as it relates to access and outcomes in healthcare. And I won't go through all of them, but kind of specific to the conversation that I heard early on, Representative Schreiber, and the conversation we were just having, we know in this community that the percentage of white Tulsans, for example, with health insurance is 35% higher than that of Hispanic Tulsans, and the Black infant mortality rate is twice that as other Tulsans. And so it's not to suggest that we want the numbers for white Tulsans to get any worse by any stretch of the imagination, but it is a clear indication that we have some challenges in this community. And the great thing about looking at the data is we have some real insights as to the things that we need to be doing and what are some great benchmarks we should hold ourselves accountable to. Before I was in the legislature, in addition to the things that Michelle was so kind to share, I actually worked at OU Tulsa as Chief of Staff to the President. And this is when we were starting the School of Community Medicine. And the School of Community Medicine at OU was really all about this overarching goal of eliminating health equity gaps as it related to things in Tulsa, specifically the 14-year life expectancy difference between North Tulsa and the rest of the community. And, what I found in those times was that the best way we could approach the improving of health outcomes was really doing it in a community-centered way. And we learned a lot thinking about that. Obviously, there's some really technical things and how you meet these challenges and access things, everything from access to specialty care, education, those types of things. But when we think about the challenge that people are facing all the time, you can only really get that information from the people who are most impacted. And so I do think it's important, and I'm happy to be a male ally in this conversation. But I do think what one of the challenges that we continue to see is there are not enough women who are leading institutions and entities who have the experience, and I'm talking about the lived experience, to really drive home a lot of the policy changes that are necessary to get us in a better position. And so I think that the road to equity and menstrual health is the same thing, same approach, this community-centered approach. Just a quick personal story, actually. My son turned 16 on the 15th of this month. And as we all know, 16 years old means something really, really important. It's time to get the keys to a vehicle. And I was thinking about when I got my driver's license for the first time. My parents divorced when I was 4 years old, so I was largely raised by a single mother day in and day out. And what I remember most about getting my driver's license is the errands I had to run for my mom. One of those errands, most consistent errand, was actually going to the grocery store and purchasing her Always with Wings, which is not something as a young 16, 17, 18-year-old boy you love walking out of the store with. But that was my experience when I was younger. Now, that certainly does not make me an expert in menstrual health by any stretch of the imagination, but it has stuck with me as I've gotten older and really impacted the way that I've thought about policy change. For example, in 2018, 2019, I actually learned for the first time that in the Department of Corrections, women had limited access to feminine hygiene products, and they had to purchase some. And working with Representative Bell, we had crafted a bill, but before we even get the bill across the finish line, we were able to work with DOC where they changed that policy and made those hygiene products freely available to women in our DOC custody. So it was an important policy change for inmates. I think that, as I think about the future of the city, and I think about the commitment we have to make to combating period poverty, what I did for my mother and going to pick up those Always Wings is there's still a gap in folks who have the resources to be able to do that very same thing, right? And so I do think one important goal in the future of the city is making sure that there is wide availability of feminine hygiene products, just like we did at DOC at all of our local public facilities, everything from city facilities and parks to the library and everything in between, because we do know that one of the challenges facing women in our community is a pay gap, and we also know that it is frankly just more expensive to be a woman day to day. And what we've also know is that the outcomes for children, as I understand them, are more tied to their mother than anybody else, actually more tied to mom than dad. And so as we think about like these additional challenges that women have, this is an important one that we know affects all women in our community. And so making sure that we're advancing gender health equity in Tulsa in this particular way, I think is critically important in an action that we can easily take. I'll also say that, as we think about it, as I was discussing before, we're not just talking about health. We're also talking about wealth, and we're talking about overall family health. Earlier in the campaign, I announced my commitment to create the Office of Children, Youth, and Families to begin to address the significant challenges facing Tulsa families. And I really do think that this is one. And so as I think about the future of the community, along with the Commission on the Status of Women, being focused on closing, this gap in health equity and advancing menstrual health, and how we spend our resources, how we partner with for and nonprofit entities, how we invest in kind of some cutting edge technologies and education is critical to the social and economic health of the city. And I know for me, it will be a priority should I be elected mayor, but you can always count on me to be an advocate for it and being a priority, no matter how an individual race turns out. Because I do think it's an important future. It's important for the future of our city. We know, for example, that Oklahoma is one of the worst states for women overall, and there's a lot of reasons why. But that doesn't mean that we can't get to work in our community and being able to cut into those numbers and making sure that Tulsa is this oasis as it relates to women's health, women's wealth. And again, I think this is such an important part of that conversation. My goal, frankly, as a leader in this community and as a member of this community, is really to partner with that community. And when I say that, with all of us, to make sure the best and brightest ideas are being brought forward, and we just don't sit around a table and talk, but we move from talk to action as quickly as possible. And I do think making sure that we have the availability of hygiene products is a big part of that. But it's also making sure that we're promoting that with everybody else that we interact with, like I said, for-profit companies, our health insurance plans at the city, all those types of things. We have the opportunity to make Tulsa, like I said, that oasis on this issue, and I'm committed to doing it. I'll say just to end, and I'm happy to, I don't know if we are taking questions or not, but I wanted to make sure I limited my comments just a little bit, because the only thing I really had to say is to talk about that commitment. But I can commit to each of you that I can always be counted on to turn advocacy into action. We did it with DOC. We'll do it at the city, and we'll certainly bring along a lot of other partners to do it with us. So with that, I'm happy to take any questions if we have them. I also, before I got on, I have to say I did visit with my mom and a few of my friends, and I was like, man, I feel like I'm gonna go talk about menstrual health, and I'm not sure I'm an expert on it. And so I got schooled up, and just hearing the experience through what it costs, particularly now with some of those friends of mine who have daughters. And I think about having a son, how lost I would have been if Gavin had been a daughter. So I do think it's also important to educate young parents and educate particularly fathers on how you support girls and your daughters and even your wives and your girlfriends and how we can make sure we advance in menstrual health equity here in this community. So thank you so much. This is an important conversation. I'm glad to be a part of it. I really appreciate the partnership, the advocacy, and I'm looking forward to the action we're all going to take together.
Thank you so much. Do you have any recommendations for how Sanicle and other organizations can work with government officials as far as grants to make things more accessible in the community? You're muted again.
There we go. Sorry, I muted myself just in case I wasn't supposed to talk anymore. So I mean, I do think that a core thing, like I'll just say this as part of as I think about the future leading the mayor's office. One of the reasons that I want to create that Office of Children, Youth, and Families in the challenge I'm going to put out in front of all of our authorities, boards, and commissions, particularly the status of women, is, hey, what are those grants that we need to be going after as a community that support us overall as a community, and figuring out what are the agencies within our community that are the ones that are going to, kind of implement them, right? Because the city is not necessarily the place that should be implementing everything, but we can be a strong anchor as it relates to being a convener and being able to secure those resources. So that's one. I think two, and this is a conversation that we've had already just a little bit, is how those of us who are in big institutions that have big health plans and push on those health plans to do more and more and more as it relates to this particular topic, right? Like, and making sure that these things are free and accessible. And I think the third thing is really working with all public institutions to make sure, as I was talking before, that the access is there, right? And that this is just an issue that's always top of mind. So I think it's really easy to say every library, every city facility, so on and so forth, we're going to have free access to things. But I do think it's even broader and beyond that, right? The reality is we don't have a city storefront or a library in every neighborhood across the community. So how do we continue to meet that need? And so I do think there's a really powerful role for you all to play in informing government on what needs to happen. And I think you do that at all levels. I think it's important to do that with the mayor and the city council, with folks like myself and Representative Schreiber. But I think it's also critical to do it with folks like the CEO of the City County Health Department, things like that, because I do think women show up in every part of our community, and there are folks who lead those institutions. And I think we all have to come together and make sure we're informing those institutions on what they have to do to better serve women and girls.
Thank you. That was the only question in the chat. And I do think we were both in the Tulsa Public School Board of Education meeting when they voted on giving free menstrual products to everybody in the school, not just the kids, but also the teachers, because having that allows kids to stay in class and not have to get sent home for missing school because they started their period.
Absolutely.
Yeah. Thank you so much.
Absolutely. It's good to see everybody.
Next, we have a fireside chat with Kyle Smith with Sakira Muhammad moderating. Kyle Smith is the partner relationship manager with builders and backers. He has built a track record of success at Fortune 100 companies, including Pfizer Inc., as well as Enterprise Rent-A-Car, Dynamic Workforce Solutions, and Grant Associates Inc. He believes that success stems from creating an inclusive workplace culture for his team while helping them reach maximum potential as professionals. He holds a Bachelor of Arts degree from Wilberforce University, the oldest private historically Black college and university. Sakira Muhammad, as you will get to know more about later, has over 20 years of experience in storytelling through various media platforms and works alongside co-founders in business development and operational success, including being our former CEO here at Sanicle. Please give a warm welcome to Kyle Smith and Sakira Muhammad.
Let's do virtual welcome. That's how I like to do virtual welcome. We're on Zoom. We can't hear. We can't necessarily speak. So let's do virtual welcome. That's right. That's right. So thank you so much, Kyle, for being here. And welcome again, everybody, to the second Menstrual Health Summit. And so what's going to be so unique about this conversation is Kyle is returning. He came right back to us because he's so passionate about these topics. So Kyle, I'm going to start right there with thank you for being here. I want to thank you so much for making it work. And just really start right there with telling us what really had you decide to come back, right? It's the second time around, and you've had 365 days to utilize your experience from last year's summit. So tell us more about what actions have you taken? What was last year like? What is happening?
Yeah, so thank you, Sakira, and the Sanicle team for allowing me to be a part of your platform this Saturday. And so just to get right in and dig right into it, I was woefully ignorant. And I learned so much last year, just being a part of the entire event, being on the panel. I think I'll share a little bit more of this. I'm the only boy in my family, so I grew up around sisters and moms and aunts and grandmas and things. And so learning what I've learned yesterday and including some of the vulnerabilities that I've suffered along the way. We'll talk about that a little bit more as well. I just realized that, you know what, this is a platform that I think more men need to be a part of. And we want to stand beside you guys leading the way. So that's why I'm back and excited to be here.
And I want to go right there. I'm not going to let anything slide. Anything you say, I hear you, and I'm going to make sure you don't skip on that. So we'll go right over to those vulnerabilities. Tell us more about those vulnerabilities. What did that look like, right? Because I'm menstruating. I don't know what you're talking about. So go ahead and tell us more about what that looks like.
Yeah, so it's again started yesterday with me realizing I was willfully ignorant as all things. Period, and I think most men, if they're being honest, will admit that. And I think where a lot of the vulnerabilities is, as you heard me say earlier, I grew up in a family full of women. I consider myself to be a mama's boy, although I don't have the soft part, but I love my mom, right? And so just understanding that, you know, I grew up with all these women that had these fluctuating things that happened to them once a month that was beyond their control for the most part. In some cases, they couldn't understand what was really happening and could communicate with me effectively. And so I learned along the way and bumps and bruises. So there were times when my mother was especially mad or my sisters were especially difficult to deal with. As I grew up, there were relationships that I had. And honestly, as those relationships evolved, I made mistakes at certain times because there were certain things happening with my partners in the past that I just didn't understand and couldn't comprehend. And I was dealing with them in my state while they were fluctuating between others. And so it really opened my eyes last year to be a part of this panel, to learn and to hear what was going on and luteal phases and, you know, all of this and all of the stuff that happens as a result of a period. It was just mind opening. I mean, it really, really was. I don't want to say mind blowing. It was mind opening. It really, really put some things in place for me.
I love that. And for those of you who were not there last year, you definitely missed it. We were in person and had a ball. But of course, you can look at the replay on YouTube. You can search Sanicle Official on YouTube and check out the replay. And so now let's talk professionally, right? You work at Builders and Backers and you work with other women and those who menstruate. So what have you been able to kind of advocate for and implement at your workplace?
Yeah, so let me be fair to Builders and Backers and let me take that hat off for a second. And that's number one. Number two, Builders, we're a remote company, so all of us work remotely. And three, I think Builders and Backers doesn't really have that issue because we're founded by two women, two very strong women, in Donna Harris and Kathleen Hale. So they do everything that they know to do to look out for everyone on the team, both women and men. But I will visit my time as workforce director here in Tulsa. And that was a time when I remember very specifically, we were moving offices. We were shifting from the east side of Tulsa to downtown on 5th Street. And there was a lot of build outs that needed to happen. And amongst the build out was the bathrooms, right? And as the project manager at the time and overseeing the one stop, the whole nine, I didn't care what went in the bathroom. It's a bathroom, right? And so, but what I vastly learned very quickly is that men's needs in the restroom and women's needs in the restroom are two completely different avenues. And so as I begin to learn and as I begin to work with Build Out, we made sure that we stocked the bathroom with the proper materials, those sanitary issues and materials. We made sure that we did that. We made sure that we designated certain areas so that women felt comfortable. And then I had a very strong deputy director at the time that was really helping to coalesce and bring and make the program very inclusive as it related to the workplace and our environment. So I'll draw on that experience again. Workforce, I had a little bit more control, but at that time, we really made sure that we, one, listened, right, and understood what the needs were and then implemented those needs as we saw fit. Not based on what I felt like was needed, but based on what on the women we were serving, based on what they needed.
Absolutely. And just because you mentioned that a lot of these places are male dominated, right? And so we want to kind of pinpoint and talk to the men right now that are in business that have the option to make a change, right? So what, from a business standpoint, in the male dominated industry, what should male employers and employees do to prioritize menstrual health in the workplace?
Yeah, number one, knock off your ego. Right? Like you just said, it's a male dominant place. We tend to feel like we're the man, we're the lead, we're the head. Not in that area. So we in the first place, thing we need to do is knock off our ego. The second thing we need to do is open both our ears and listen to our female counterparts in terms of what they need, right? Because again, I grew up in a house, all women around me. I never knew, right? I never knew. We just heard Monroe Nichols talk about being schooled up to prepare for this, right? We as men, we don't know nearly as much as the woman does going through this situation. And depending on the family structure, even sometimes women don't know as much as they need to know. So that's why companies like this and programs like this are so valuable, because it's a learning tool. It really is. I have family in town. The same family I was talking about, Chicago, they are coming in town right now from Chicago, getting ready for them. But this is what it was so important for me to be here that I set aside that to come here, because I'm really drawing upon my experience. I'm really drawing from the things that I've actually went through, the things and the situations that I've actually lived. And it was, like I said, mind-opening. And that's what it takes. We have to knock off our ego as men. We have to listen to our female counterparts. And then we have to deliver. That's the third thing. And deliver on what it is that they need.
And you know what? You touched on a pretty important topic, because also this is being streamed, and even the replay will be watched during the holiday weekend, where people are going to be around family members all the time. And it actually does start at home, right? And so what are some of your tips as far as that conversation starter at home that could then be later safely brought into the workplace?
Yeah, I think it depends on, the age appropriateness of your family structure and who you're dealing with, right? My family seems to be, everyone's of age. So for me, I don't have to really worry about that. But for my nieces that may come by, right, that are looking or may be going through that transitional period, right, it's really talking to my sisters and making sure that they have what they need, making sure that they're not embarrassed if something were to happen, and we can support them, first supporting the family, my sister's their mother, right? So first supporting her as the mother, but then as a family wrapping around it, just making sure we don't make those situations embarrassing. I remember being a fifth grade and a young lady in my classroom got her period, and no one in the class really knew what was going on. And I remember the young lady feeling very embarrassed about what was happening, right? And it's all a natural thing, but because we don't know, we're not really educated to the degree we probably need to and should be, sometimes those things can become embarrassing. So just making sure that we remove, right, the barriers of ignorance and embarrassment, so that our people and our loved ones and our friends are comfortable.
And so my last major question, and then I'll open up to the chat. I'll take a look at the chat. If you have a question for Kyle, put it in the chat. But my final question is, we're thinking big on the HR policies, right? You mentioned the bathroom, you mentioned the conversation, you mentioned listening. But what other policies do you think could be implemented to improve mental health support in the workplaces so it's more equitable and inclusive?
Yeah, I think that's a really good question. I think that's a question that I wish Monroe Nichols was still on the panel for, right? Because you can only do so much within the workplace, right? And depending on what that work environment is. But anything beyond that, then becomes a city ordinance, a state ordinance, and sometimes, depending on your situation, a federal ordinance, right? So it really starts with what you can control. So I encourage everyone that's on this call that's listening, start with where you are. right? Start with what you can control, right? Because if it was a perfect world, we wouldn't need this platform. We wouldn't be here now, right? But it takes all of us to make it a perfect world, right? In utopia, we're not having this conversation. In utopia, Sanicle is not needed because we're addressing the needs at scale, right? So I think it starts with really for us just controlling what we can control and communicating. And if we can control what we can control, us as men in the workspace, knock off our ego, right? Listen to what's being said and communicate and then execute.
There we go. Listen and communicate. And I feel like I gotta say that again. Listen and communicate.
Yeah, that's the
All
key.
So before we wrap up, I see a question in the chat. How can I feel like that was the question I just asked. Policies. Yeah, I think I just asked the question. So great. Any one-liner that you can think of that you want both genders to take away from the conversation?
Ooh, a one-liner that both genders can take away. I thought you was just going to sign it to one. I think if it's a one-liner for both genders, then it's listen and communicate, right? Just listen to what your partner is saying and communicate through it. I mean, it's really just as simple as that. If we can just apply that in all areas, if I listen with the intent to understand and communicate with the intent to be understood, I think everything could be resolved that way.
There we go. Well, Kyle, thank you so much for your insights and your expertise, and thank you for your passion as well and your support. And we will continue to have this conversation. This is just the beginning, so definitely be sure to engage with Sanicle on social media and let us know your takeaways, let us know your favorite part. And Kyle, you didn't put your handles on your name, but where can people find you on social media?
Yeah, I did not. But I'm very simple to find. I'm really usually not on social media. But if you do, it's under Smitty Kyle, SMITTYKAL. But usually I'm on the work front. So Kyle Smith on LinkedIn and Kyle at buildersandbackers.com for email.
Thank you, Kyle.
Thank you. And I just want to say again, go ahead and book me for next year as well. I will be here as long as you guys are having it. Thank you so much for including me.
Thank you so very much. I'm going to see if we can do a quick poll before we jump into our next session. What percentage of women reported taking off work because of period symptoms? Give it a couple more seconds. The answer is actually 45.2%. All right, let's move on. Now we've got Chase and McBignion moderating a panel with Kelsey Nicole Nelson, Helene Olin, I'm so sorry. I am stumbling over your names right now. Essay Ofuri and Marlo Cornelison. Chase, in addition to being Sanicle's chief period officer, works at grassroots and subnational levels within communities and states across Nigeria, facilitating interactions between citizens and the government on how to solve community-based issues. He is a 2022 recipient of the AmeriCorps Presidential Service Award for analytically driven ideas. Kelsey Nicole Nelson is an award-winning professional broadcast journalist and radio personality. A well-respected figure in the Washington, D.C. sports scene, she expands her influence into community empowerment, including her All Women Are Beautiful campaign and numerous nonprofits, and of course, volunteering with #HappyPeriodDC. Helene Olin is an award-winning opinion writer for the Washington Post opinion section, an expert on money and society with a deep understanding of public policy. She writes, speaks, and consults on issues including Social Security, retirement, healthcare, student loans, and women's financial issues. She is one of Business Insider's 50 Women Who Are Changing the World. Essay Ofure is a owner, editor, and publisher of Inspire Magazine, a publication dedicated to showcasing inspiring stories and real entertainment. A Bronx native of Nigerian descent, Essay has carved a niche for herself in the media world. She holds a BS in Management Information Systems from Alabama A&M University and an MBA in Business Technology Management from the University of Phoenix. Marlo Cornelison is the founder of Period Reality and Run for Life, CEO of World Merit, and co-creator at Humanity Lab Foundation. She fights for gender equity through system-level change by educating about and advocating for living in sync with one cycle. Her global reach through her work puts her and Period Reality on track to inspire, educate, and empower 1 billion people by 2030.
Thank you so much, Michelle, for those introduction. And it's so exciting to be alive at this time with these amazing women in the media, out of the media, who are doing exceptionally well. I know Cassie and Elaine will also join us soon due to some technical difficulties. But it's interesting to be leading this panel, which is FemTech Reporting Best Practices, the panel you never knew you needed. One of the exciting things and why we created this panel was because we're looking at navigating the world of FemTech reporting. The conversation is beyond period poverty, is beyond FemTech practices, but what exactly is the media and those who represent the media are contributing. You know, it's just like when you're assembling the IKEA furniture without instruction, it's confusing, it's frustrating, and it's potentially disastrous. So we're here to smooth out the bumps and also help you avoid those, oh no, what did I just publish moment, you know. So our expert panels will dish out tips. They will share their hilarious and cringe-worthy moments of how they've been able to at least use media to drive this conversation. And we'll also help you to nail this conversation with finesse. So most of the important thing is that one of the goals of this panel is to help us demystify FemTech. You know, want to be able to help you clear the misconception and also spotlight the real issues. But first, we have these amazing people. We want to hear from them, you know. So first, we'd like to speak to Marlo. Marlo, in your 1-minute speech, you know, why are you excited about this panel and what are the things that you feel has been overhyped about the media and AI? Thank you.
Wow, thank you so much for having me. Yeah, I mean, I'm fairly new to the menstrual health and femtech community worldwide, but I have a background of working in the social sector, working with mostly young people around the world. So I understand the importance of reaching a global audience, you know, made a lot of mistakes in that space. Luckily, we've also had a good few wins, especially around engagement around topics that are important as well. And I'm hoping to bring all of that into my work with Period Reality. And I'm super excited to be talking about that today. So yeah, thank you for the opportunity. Very happy to be here.
Thank you so much, Malu. I know we've gone way back with World Merit, you know, with the last experience in London and also in Morocco. And you're one of the greatest inspiration for me, especially in leading this journey. But truly for us, one of the segments of this event is also making sure that at least you can share your experiences, especially in establishing ventures that are focused on social justice and menstrual health. Your stories residing from the United Nations, working with British Parliament. It gives us an edge on why important this topic is.
Yeah, I mean, you know, it's always been very inspirational to me that a lot of the most important work happens on the ground by people who don't get the spotlight. And I always felt like it was our job as an organization pushing for that, you know, in my background with World Merit to kind of bring those stories to the forefront. Some of the biggest heroes are people who are not necessarily shouting that from the rooftops. So it's important to find ways to give that a platform. And that can be directly in the media, but it can also be through partnerships with institutions like the UN or the British Parliament or any institution or organization or brand that can give someone some credibility to their work, right? And it's very unfortunate that a lot of the youth that we worked with, really at that grassroots level, their work just wouldn't translate to the global stage often because people really struggle to understand what the work meant on a hyper localized level. So for me, that, collaboration here is key, and I'm so happy to see that happening today as well, with so many incredible partners and speakers coming up representing different parts of the ecosystem. Because only when we get together, you can really create that platform for, to highlight and shine a spotlight on those people doing incredible work on a grassroots level.
Thank you so much, Malu. Bomisi Media Weekend was a love at first sight with Essie, who is publisher of Inspire magazine. What would be your experience, especially with this topic, the role of digital media in promoting FemTech and menstrual health, your initial story?
Well, I would say that first and foremost, thank you for having me on this panel. There's a lot of exceptional people doing a lot of great work, and that's the benefit that I've gotten from Inspire, is to continue to meet people doing great work in different sectors. And even when I met you, I was confused. I would not lie. I was like, okay, what do you mean you're doing period health? And then, the more and more I looked into the work that was being done, I saw the importance of it, right? And then I realized that we all kind of have been highlighting it, but just not in a particular type of way. I do mentor college students, and before that, I was a substitute teacher in New York City public school. So it was just one of those things where, okay, if there was a girl in my class and she was just, not really attentive, she had her head down, it was just a matter of, okay, what was going on with her, what type of attention that she needed. So that was, having that conversation with you and then going back and looking at my experiences. Okay, yes, this is something that definitely needs to be highlighted more in media. Not just for professionals to, speak in their areas, but for us to, bring more of a spotlight to it regarding our platform. So definitely promoting FemTech and menstrual health is important, because that's what Inspire stands for. We like to highlight the positive things that are influencing and encouraging people. And this is a mission to encourage our youth. We are all, we consider ourselves leaders, but we also have to mentor the youth to become future leaders and bring these type of conversations to the forefront. And that's just been my experience, is just showing the youth that they do have a voice, that they can be leaders as well. So, that's been my experience, and it's just been great to continue that, to meet more people, more individuals who are spreading this particular mission. So that way I can actually highlight it on my platform and other people will read it. And then from that'll create other stories, because that's kind of how media works. It's like a domino effect. Once we find something that a lot of us are talking about, we'll figure out a way to make it trending, to bring it more attention. And that's our role. And that's what I'm really proud that I can do. And, that's why I'm on this panel. So thank you again for having me.
Thank you so much. And you guys, if you're still just joining us, it's still the FemTech reporting practice with these amazing women. Still that Bomisi Media Weekend, we've read about the Super Bowls of Grammy weekends. We've seen the red carpet, and having Kelsey Nelson is so much an exciting time to be able to at least hear from her about sport journalism and also sharing our own story with Happy DC. Kelsey, how did you break that story?
Thank you so much for having me again. Just delighted and excited to be on this panel with such phenomenal women. It's good to see my Bomisi family back. It's crazy to think that it's almost been a year since I've seen you all. And I guess what kind of brought me here is that so many people, I think, always think that sports is a separate anomaly and sometimes not intertwined in culture and everything that we look at and do. But actually what got me into sports is because I really do think sports is a universal language. It's like the one thing that really does connect us all. It doesn't matter what country somebody's from, what background. Usually there is some type of sport in that country that people love and that will bring different people together. And if you think about it, it's really the only instance where you kind of see unity amongst people, right? You don't care if you don't like that person. If you're rooting for the same team for those couple of hours, you're going to be together. But I think in women's sports, and there's a big phenomenon right now in women's sports, especially right now in the US, but nobody wants to say the quiet part out loud. Yes, there are females that have periods that go through menstrual cycles, and they're still able to be these phenomenal athletes. And, so often when I'm, covering sports games, it's always like the backroom talk or something that somebody whispers and doesn't want you to say aloud. But I really think we need to make that part common, right? It's part of our identities. It's hurting our young girls. We're seeing less and yes, young girls playing sports now because they're ashamed, quite frankly, to keep going with the boys because they're afraid if something happens to them while they're playing sport. And so when that puberty part happens now, many of us women remember, you're insecure. Our bodies are starting to change. You're trying to have those conversations with an adult in your life, whether that be female or male. But things change for all of us. I think for me, it's wanting to make sure that, all of us are able to have those conversations with young people, that we as adults are also comfortable having these conversations as a whole. And I think for me, why I'm really excited again to kind of be part of this conversation and kind of going back to what you said is because this needs to be normalized, not just in sports, but in every conversation, that we're having. And again, we shouldn't be ashamed. It just needs to stop. Like, I think we should be able to be confident and loud. And I think what the FemTech space is doing is so important. I don't think there's enough conversation around it. I teach as well. And I think, it's something with my students to learn about and to be comfortable with, because we really are ready to pass the batons. I think that's why it's most exciting. And, we're talking about Super Bowls and you're watching all these, and we're about to watch the Olympics right this year. Think about the story behind the story. And that's kind of what I like to dig at. And those are the stories that I like to uncover because if somebody's not talking about it, I have been so privileged to have a microphone and a mic and be able to start that conversation. And so I think that's kind of our job as media. I will always be a proponent of using your platform for a purpose fueled by your passions. And this is my passion. Happy Period DC was a group, I was so excited to work with here in the DC area. We used to give menstrual kits pre-COVID, of course, pre-COVID, and COVID happened, but we give menstrual kits to homeless women here in the area. And it's, again, something that people don't think about, but it's something, again, that all of us have to face and fight, and nobody should be ashamed of it. So I'm so glad to be part of this group of Black women actually doing this in the community. And again, I like to highlight their stories and the great things that we do, because I think the world just needs more good. So excited to share good with you guys and hopefully learn some challenges that we can hopefully overcome together, because we know this issue and problem is not going away, and hopefully this spurs others to have the same conversation. So thanks so much for having me.
Thank you so much, Kelsey. If you feel nervousness in my voice, it's about this next speaker. I chased her practically on LinkedIn to be a part of this panel. One of the most exciting things is that I've also been chasing the Reporter in Residence program at the Old Media Network. And when I came across Olin's profile on LinkedIn, I reached out and okay, this media crutch of mine, who has just even recently wrote a latest for MSBNC, which is how Live Nation Ticketmaster became the villain of our time. But today is FemTech. It's menstrual health. It's also our work with the Old Media Network. Ellen, please, you have the floor.
Oh, thank you for having me. I think I'm almost accidental here because a few years ago I wrote about menopause, which is another topic that is actually related to this. So I'm going to get to that in a second. But for me, this period begins in two ways as a media thing, which is first with the beginnings of Jezebel, the old Gawker blog that was edited by the great Anna Holmes. Around 2008, 2009 really starts the conversation around this. And then you start seeing other women's blogs beginning to, come in, like Slate's Double X. Salon had one that I'm blanking on the name of now. And then, of course, New York Magazine's The Cut, which is still here. And then, a second thing happens, which is about 10 years ago, too, and I might be slightly off on my dates with this because you guys are the experts on this and I'm not, was the cup. And, that suddenly changes the entire conversation because all of a sudden there's something new to discuss. And so when that then in turn combines with, this sort of coming up from the blogosphere, this sort of combination of Gen X editors with millennials pushing at the boundaries of what can be written about outside of the health pages, you all of a sudden see this sort of explosion of conversation about periods, whether you should even have your period. Remember the whole thing where you could just take the pill full time? There was a way to take the pill full time, and you shouldn't have your period at all, right? And so it was this really great thing because it sort of brought this topic into just normal conversation. And I think intriguingly, menopause is now where periods were about a decade ago, where this is also suddenly just leapt out as a conversation topic, where it was also something that was almost never discussed, was whispered about in very embarrassed tones, and now is actually so openly discussed. I joke that in my middle age, I think I've had more conversations about menopause in mixed company than I ever had about my period. So, I mean, that gives you a sense of how quick this change happened. And I really do attribute a lot of it to just initially the blogosphere and then social media really pushing this narrative. I mean, I know it's, very fashionable, and believe me, I share it, to trash social media, for all the disinformation and all the, it's repeating conspiracy theories, and, it's promoting Trump and da 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 da. But in fact, in a lot of ways, it's been really great. And I would argue that this is actually one of the areas where it's just been phenomenal, actually. And with that, I will stop talking and let you guys take over again.
Thank you so much, guys. I know this is a 25-minute panel. We're taking the very first 5 minutes, making sure at least we also have the remaining 5 minutes for SA to give a rounded tip. But quickly to the major conversation, I will go to Malu from Period Reality. So question for Malu is like, can you share a successful example of a social enterprise or nonprofit initiative that you worked with or you've partnered with, even since the inception of Period Reality, that have made a significant impact on menstrual health or social work that could lead into the impact of period and the state that we are currently?
Yay, thank you. Yeah, definitely. I mean, my whole background is in the social sector, and I think one of the biggest struggles has been this huge stigma around charities and people in the social sector, and that they don't know how to run a business. And obviously, the biggest challenge of running a social enterprise or an NGO is often funding. And I think there's that very fine line in encouraging charities to take some of the stuff that's good about corporations and running a business and take that business mindset into the social sector, whilst keeping the intention around, your ethics and your integrity, and being with your vision being aligned with things like sustainability and justice and fairness and all the things. And that's something that, I think is a biggest struggle of the social sector at the minute, because I feel like it's a constant debate, whether it's about paying people fair wages. We never have the resources to compete with what the big corporates are paying people. But it also means that even when you find really good people, they often can't stay with you long, because you can't offer them that fancy car and, a new laptop each year and all the things. So then they leave again and you're losing talent. But as soon as you start paying people competitive wages, then you're obviously scrutinized for paying people too much money, because you're using donors' money to pay people proper wages. So I feel like that's the constant, the line we're trying to walk in the social sector. And I think we just need to meet somewhere in the middle where, the focus of corporates needs to change, so that the ROI is not just money down the line, but it's also impact. And for social enterprises to, also really step into, and especially charities and NGOs, to really step into their power and say, you know what, I'm going to run this like a business. And this is what we're trying to with Period Reality from the get-go, that we have as well as a social enterprise, as well as a non-for-profit, to make sure that we have a constant revenue generating model, bringing in money, but then at the same time, we're also looking for donations and applying for grants to make sure that we reach those hard to reach communities, that we have that global platform, and we can allow ourselves to do these projects and programs that don't necessarily bring in a lot of money, but have the biggest impact, right? So, I think that's a fascinating conversation that's taken place in the social sector. My experience in the menstrual health sector, so Period Reality is a global movement to achieve gender equity through system level change. And we do this by educating about and advocating for living in sync with your cycle. And it is kind of based on this foundation where we live in a world that is designed around the 24-hour hormonal cycle of men. So there's an expectation of showing up consistently, which is not in line with the way that female bodies are built, right? As soon as you have a menstrual cycle, let's say on average, it's 28 days. Every single day, your hormones are balanced differently, meaning that you show up differently. And that affects your energy, it affects your mood, it affects your strength. That's why I love that conversation around sports, for example. But even in journalism or for performers, when you're on a stage and you do the Super Bowl performance, if you're being fitted in a super tiny, lovely, gorgeous outfit when you're ovulating, and you tend to be, very confident and outgoing and you love the spotlight, you might feel great in that particular outfit. Whereas 2 weeks later, when you're heading into your period and you feel bloated and insecure and all the things, you don't want to be on the spotlight, but you still have to perform. That's things that we don't really talk about. And that's kind of what we're here for, to help people understand that, it really does require a system levels change, because the way we run our businesses, the way we operate, it is on that expectation of showing up consistently. And at the same time, we're all cyclical beings, because we've got the 4 seasons, that we're, or as many seasons as where in the world you are, but there are seasons that we're all moving through. We have our circadian rhythm, we have the moon cycle. There's all these cycles happening that we're part of. And I think, we just need to understanding that how we show up depends on where we are in the month and how we respond to that. We can just be a lot kinder towards ourselves and give ourselves more grace around how we're feeling. And that's a message that, as you said, Chase, that I'm hoping to spread to at least 1 billion people by 2030. So yeah. Does that answer the question? Sorry,
Yes,
that was
it does. It does. Time zone different. So exciting to have you here from the United Kingdom. My next question will go to SA. As a feature writer at Bella Nigeria, and also have contributed on your platform, where we broke the story around the Father's Day around Kevin Hart and the daughter. What would you see as best practices about impact, especially on your platform promoting menstrual health?
Well, first and foremost, I would say that for my platform, that I just focus strictly on the positive things that people are doing for themselves and their community, regardless of their lifestyle. So regardless of whatever industry you're in, we try to find the positive aspect of it. And for instance, when you brought that article to my attention, I said, okay, here's a celebrity and here's his daughter, right? It's something that can be relatable to most men too. A lot of fathers have daughters and they go through the same thing. However, Kevin Hart just has a bigger spotlight. So let's try to capitalize off of his name and the fact, that he does have a daughter and that can relate. So sometimes that's kind of like the challenge when it comes to sharing these important stories. A lot of people want to know the action or the gossip or all of that stuff when there's these things that people deal with every day that they have questions about. And if we have these stories on media, these questions will be answered by the everyday people. So sometimes I find myself always trying to, figure out how do we get the positivity with what's trending. And that was a prime example of it. And I get stories. I've actually met, I forgot the name, I think it's She Knows. It's one company and she's based out in the UK as well. And she came to New York and she did this session and she partnered up with someone. So again, it's about how can we take this message and just capitalize off of what it's normal to people to pay attention to? You know what I mean? Like, that's just the only way. And that's honestly how we can do it, is trying to figure out how we can relate these stories that happen every day with women, whether they're in sports, whether, you're in corporate world. I was in corporate world before, and some days I just didn't feel like going to work because it was that time of the month, but nobody understood it, or you felt it's nobody's business. So you didn't really explain that to your employer. So it's all these levels of information that's necessary to understand how to continue to navigate. And by utilizing stories and putting them on our website, that's the best that we can do, and make sure that we get more eyes on these stories. Just because we put it on our platform and it's published, I don't just stop there. I'm going to either, email somebody or, go in a couple of groups and put the link in there. So, and then make sure I mention a couple of particular words that will, just engage people to want to have more conversations about this. And I'm finding out the more uncomfortable the conversation, the more engaging it can be. And obviously this is an uncomfortable conversation, especially when you have it in a room full of men. And I think that's what we're going to start reaching for more, is to have more of these conversations. Men get married, men have wives, men have daughters, so it's like, this is not a topic that is foreign. It's a topic that everybody goes through. So from a media perspective, and what Inspire does, it's just a matter of me continuing to share those stories, but trying to make more of an impact and getting more eyes on this story, because once the eyes see the story, they're like, oh yeah, I went through that, or I have an aunt, I have a sister, I have a daughter or a grandmother, or I remember it's all these things that we can incorporate to make it understandable by the masses. So that's kind of, where I see Inspire going. And I'm also assuming that a lot of other platforms will be doing the same, because these are important issues that we need to spread the word about. So I hope I answered that question as well.
Thank you so much, SA. I'll just move quickly to Cassie, on health talent at NBC Sports. How would you say effective strategies for engaging male audiences in conversation about women's health through sport journalism, especially, these are fathers to daughters, they have their spouses. How can sport journalism play that role?
Yeah, look, I'm a daddy's girl. That's how I got into sports. And so my dad had to learn early. Sometimes, Dad, I'm not going to play the greatest right now, because there's some things happening right now with my body, as Marlo alluded to. And I think, honestly, sports is how we have that conversation. I don't know if you guys remember back in 2016 at the Rio Olympics, but one of the big storylines coming out of the Olympic Games was a swimmer from the Republic of China that actually had said, like, she had done not horrible, but she did bad in the 4x100 meter relay. And essentially after it, she said, hey, my menstrual cycle started yesterday. It's not why I lost, but I just wasn't feeling the same, right? Our bodies change, and it made people have that conversation. And even men, during the Olympics, people don't care who it is competing. They want to root for their country, right? And that country is supposed to make them proud. So I think sports, again, kind of makes us have that conversation. Right now, we're having that conversation in Florida. So Florida is a state that always has a lot going on here in the United States. But again, through sports, and through what Florida has done with abortion and the transgender sport athlete, again, which is also making a lot of people really involved in sports right now. And again, as it relates to female athletes, to menstrual cycle, and so on and so on, the Florida high school administration actually just took off questions about females' menstrual cycles. So you guys remember back in school when you had to put all your medical history, your dietary history on all of those forms, there were questions for females about when their last menstrual cycle was, right? And so a lot of us now as adults, we really only probably answer that when we go to the gynecologist, but this actually had a weight on female athletes for many things. Think about scholarships for female athletes. Think about if you start or play a game for female athletes. So they had huge repercussions. And again, there's a lot of males coaching women in sports. So I think why sports is so good for a spotlight, because sports will always kind of, I think, have a relevancy in the news cycle. Like right now, of course, it's Caitlin Clark right now that's taking a lot of headlines right now in the United States. But Caitlin Clark is like many of us on this call, and she has a menstrual cycle. So I think it's really embodying athletes to have these conversations. Again, I think, as Eske said, it make that uncomfortable comfortable, because it's part of us. So take it or leave it as is, but that's part of the storylines. I think the biggest thing is, again, making sure that these storylines get in the spotlight. And again, not to say that this is going to make athletes feel worse. And then also, I think we need to highlight the young girls as well. About 50% of young girls have stopped playing sports now when it comes to puberty. I can't stress how big of a number that is. I hit puberty at 9 years old. I was super early. It's a family thing. Everybody in my family hits it early, and I had this super heavy period. I was an athlete. I actually stopped playing. You guys are the first to know this. I actually stopped playing sports for a time because I didn't know what to do with my body. I just felt really uncomfortable. I was too afraid to tell my parents. I was the only child at the time, and a lot of females are still facing this. I was a child back in the 90s, y'all. It's 2024, and they're having the same conversations. So I think as much as we kind of got normalizing these conversations in sports and making sure they're at the forefront of conversations in newsrooms, to our editors, and many more.
Thank you so much, Kelsey. Right after it, I know the panelists and producers are telling us we're out of time, but Ellen, quickly, America Economic Liberties Project, how, from your experience, being a reporter in residence at Omidyar Network, how do you see media coverage and shaping public perception and policy around menstrual health, especially now that we're counting down to the US elections? You currently wrote recently about the Biden administration. What do you think the US government should do about menstrual health policies, especially in the workplace? And how do we broke that story on MSNBC Nest on the topic of US elections and menstrual health?
Well, I think the real story right now is, and I think for obvious reasons and quite related to menstruation, is abortion and pregnancy. And I think that is going to be the issue. I'm not going to let that dominate this panel, however, so I'm going to just leave that thought there. For me, the thing I would say is that I think we're all discussing sort of, talking about this issue and talking about, the obvious truths of it, that, yeah, we have days where we feel better and we feel worse, and men tend to not have these quite the same way. And I would say the one thing we need to be very cautious of, and I don't really have an answer on how to do this, so I'm just throwing this thought out, is that, this stuff has been used to stigmatize women in the past, right? Oh, you're weak. You can't work today. And you're seeing this again, not just with menstruation, but with menopause, where there's been a movement, particularly in Great Britain, to give women days off to handle it. But you can see very easily where that could slide into, oh, you're having brain fog, you're not up for this job anymore. So I would just say, that we need to really emphasize when we talk about these issues, or when we write about these issues, that, these are just things and they happen, but they are in no way disqualifying, and that the vast, vast majority of us, even as we are talking about them, have somehow figured out a way to work through them in the past. And that simply because we are discussing them does not mean that they are inherently, disabling in some way, which is what often quickly translates to by people who are not particularly well-intentioned. And I know we have to go, so I will leave that there. But if you have follow-ups, feel free to get me now or afterwards. So.
Yeah, thank you so much. The conversation is going to continue. We're going to have a full live coverage of this again. We're going to at least have you invited again so that we can ask you all those questions. But I would just like to conclude with Essay giving a summary of the insight that we've learned and how we can take this conversation forward.
I mean, thank you so much. I think this was a very insightful conversation from different aspects, right? We have, general-based media. We have Period Reality, which is actually an organization focused on that specific conversation. Then we have Kelsey, who's coming from a sports aspect, but yet we don't want to just categorize it in sports. We want to categorize that as another area that this particular issue affects women, right? And then for Helene, it's just a matter of how long have we been having this conversation, right? Let's change how we talk about the conversation. It's not to make women say we're weak. It's not to say that, we've been getting through it, right? But just because we've been getting through it doesn't mean we want to continue to get through it like this, right? We want to better understand. We want everybody to understand that, yes, we are strong. We do have moments, but it's not going to stop us. However, the younger women, we have to educate them. The younger men, we have to educate them as well, so that going forward, these conversations will not be, awkward. These conversations can be something normal. It can be something understood. And that's where the advocacy part comes in. We all are here to advocate for a different aspect of the same issue. So just because we have one issue doesn't mean we all have to go about it the same way. So I hope that everybody who's watched this, take a moment, follow all of us, see the work that we are actually doing, and, take a moment to summarize that and see how important it is from every different angle of media, of entertainment, or just in general, where we're coming from to address these particular issues. I think it's very, very important. And I think that, I'm motivated by the women on this chat because of the work that you've been doing. And I think that those people who are watching will also be motivated as well and learn a little bit more about FemTech, learn a little bit more about advocacy, learn a little bit more about the issues that, women do face on a daily basis, because we all are in this together and we're all here just to make it easier for the youth. Okay. We all have been doing this, but we want more. We want it to continue, and we want them to still have that same passion. So everybody do your due diligence, follow us, see the work that we're doing, advocate whatever way that you can, because each way is something it's an addition to the movement, because this is a movement and the movement is not going to stop. So everybody, thank you again for your time. I'm S.A. Ofuri of Inspire Magazine. And again, I'm just proud to be on this panel with all these wonderful women. And Chase, thank you so much for the invitation, because of what your organization, Sanicle, is doing. Again, it's something that's very important, not talked about, but it is talked about. So we need to talk about it some more.
How I broke the story, Malu, S.A., Cassie, Elaine, thank you so much for your time. And the conversation still continues.
Thank you so much. Next, we have Abdul Yukusenge. He is dedicated PhD candidate at the University of Warsaw in security studies, specializing in the critical nexus between contemporary security challenges and the principles of the responsibility to protect, reinforced by a deep understanding of geopolitical, environmental, and social factors. He has earned a BA in International Relations, an MA in Political Science, and an MSc in Sustainable Development. Please welcome Abdul Ukasenge.
Thank you. Thank you very much. So I'm very, very, very grateful to be here with the team. So the expert in menstruation. So I was very happy when my brother Chase invited me to this event because I'm always involved in this UN, SDGs. So when you talk about menstruation, it's about SDGs. So we see how we can help the community where we live and where we want the world to be. As Auntie Hawa also spoke before, so we do work collaboratively with her and see how we can help our communities. So I'd love to ask my colleague to just present my slide here and can try to say something here. Yeah, initially, as I come from Rwanda, Rwanda is a country that is actually in Africa, but I live in Poland. So when I talk about Rwanda, it's another thing that we need to understand about how gender equality is, being managed by the government, and also the government step in to help the women. For example, we do have the free part. Let's say, for example, it's not the free part because they do give to these communities that live like in rural areas. But when you look at the government policy for them, they do have a policy that abolish the tax on parts. For me, I still feel like we are still far by imposing tax on the parts. So I think everyone should have free parts. So how can the government, business to business, and also business to government, they can work together in bringing up this issue together and see how they can help people, like, to have like free parts, like women, because this thing is really all as human nature. So we were born there. So our mothers, our sisters, they were born even before our ancestors. So they have this issue. So why should they have to pay for the human right? This menstrual issue is a human right. So why do we have to pay our right to have access to what we need? I can ask for the next slide, because as we're talking about the technological issues, I think it is important for us to understand how these business-to-business companies, how the government and also business companies, they can work together. So I had a chance to work in some of the companies like Amazon, GlaxoSmithKline, SC Johnson, and so on. I tried to see how these companies, they have leveraged, let's say, how they can also try to help the employees into that. So for me, I've never seen that, even though I live in Europe. I never see something like that, like a free pass at work or anything. But only at our university, I saw that the government of Poland has provided this. So we have the free parts at university, so students can also have them, like ladies, they can have free parts in the at the campus. But I think it's very important, as I said, why do we have to pay for what we need for our rights? So I don't think for me, I need to have, or my sister should pay for her access to parts, because the part is part of her rights. So if we have the possibility of having them, so the government should also support us. And maybe, as you said, the business to business, they can work with the government. They see how, for example, they can reduce their tax in other things, and then they can provide free pads to people. But I think it's a big thing because they want to make money, they want to generate income. But the government also, as a parent, they should also look for something to provide for young ladies, especially, for example, we in Africa, some ladies, some young girls, they never have this chance to access to these parts, or maybe some mental health hygiene. So it's really important that we do understand, because when you're talking about the technology and what kind of software we are, so we are in a really emerging, or let's say emerging AI community where we live. So we live with AI. So how does this AI is going to help us monitoring, or maybe helping us seeing how our young girls, they can also try to monitor their periods. So it's really something that is important, because when you're talking about the menstruation, is about also mortality, is about demography. So how do we have to measure that? So the government has a role to play here. The multinational companies also, they have a big role to play into this field. So I think, like, when you look at the data that we have from World Health Organization, World Bank, you see many places, only like African countries, Middle East and Asia is where we still have these problems, whereby people, they do not have let's say, access to these tools. Let's say, for example, why do we also have to pay for an application that will help us counting the days of fertility or anything that should be done? So I think it's very important. For example, let's say a company like Procter and Gamble, they do produce pads. So if they do produce pads, why can they also give them free? I had a friend of mine, I asked, so does the P&G, these Procter and Gambles, give you free products? They told me no, because for them, they produce the parts, they also produce the pampers for the kids. They told me they can give them at the low cost, but they cannot give them for free. So you can see that it's not only that the producer of the product can give it freely, but also there's some money to pay. Not everyone can be able to afford these products. So I think for me, it's really an important thing. But I think also, as we are advocating for these menstrual health issues, but also we need to advocate for free products. So people should have the free product, because we don't need to pay for what we're entitled to have. Because when you say justice, everyone has the right to justice. So why should we pay for the pads, yet it's also part of the human right? Because in Poland, they say pads also, menstruation is also about human rights. So if we have a human right, so why should we pay for that? It's really important for us to know that the government should provide the public goods. The public goods is also part of what we need. Our sisters, our mothers, our aunts, everyone who is really affected by this issue, because when we're coming, all of us here, we're coming to brainstorm about this issue, we're trying to advocate about the issue, is because it's something that really matters for the community. So I think it's very important, because the menstruation products and services that should be given to employees, people who work somewhere, they should be given this for free without any cost. And I think also the most important thing here is about lowering, for example, those people who do have access to these products. Let's say, even though you work for the company, but I think we can have eco distribution of these products. When you look at the issue that we talked about earlier, many people, they were trying to repeat it again and say, for example, the government is helping. So for me, I feel like the government should establish, or maybe from the policies that will help the health sectors to provide this product for free. And also the web application can also, for example, we have a national web application or software that will be free for anyone who has a smartphone, that will help people to count, or maybe to know their fertility and so on. But the thing is also, if you want to use the application, you need to have education. Education is very important. So for us to know what we are going through, about our body, about our, our transformation. So we need to have a key asset, the key asset about the tools that we do get, the key information that we need for us to make sure that we live in a world that is really, that copes with these changes, the change of technology, the change of adaptability, and also security. So not everyone is able to share the information about this issue, because people, they feel embarrassed. People, they feel like really they have the fear of embarrassment. When somebody's in a period, cannot come and tell everyone. So the human resources at any office or any company should have like somewhere something that will be used for people to know, but it's not about the information to be shared by everyone. For example, in Africa, it's about the culture. So not everyone should share that, or maybe reveal that they're in periods. But the thing is to help the people who are in period to feel better, and also to be considered. And I think it's very important for us to know how the government can work with business to business, and also business to business can also work with government to business. So it's about interconnectedness and also intercooperation between them. Thank you very much.
Thank you so much. All right. Next on our list of speakers is Sajida Ghosh. Sajida is a venture advisor and ecosystem builder passionate about empowering founders and driving innovation, especially in the US Midwest. Her journey in the entrepreneurship space started when, fueled by her own battles with anxiety, she founded Stopanic, a startup helping people manage panic attacks with therapeutic music and on-demand counseling. Now, in her role as a venture advisor at I2E, she coaches the next generation of Oklahoma founders, helping them refine their ideas, build fundable companies, and access capital to scale. Please welcome Sajida Ghosh.
Hi, everyone. So exciting to be here. I've been following everybody's presentations all morning. Okay, I'm just going to set my screen here. Can you all hear me okay and see my screen? If I can just get maybe like a thumbs up. Okay. Roxanne, sorry, one second. I'm having some issues seeing the speakers. Can you tell me if you can hear me okay?
Yes, we can.
Okay, perfect. Okay, we will get started. So I'll be talking today about how do we unlock the next 100 million in funding for FemTech founders in menstrual health technology. But before we jump into that, I want to share a little bit of a story with you all and tell you my why. So this is a picture of my mom, Shampa Ghosh. She is in a career of a life insurance agency. So she was a life insurance agent, and this is one of the early first pictures of her when she started off in her career. She was one of the very few women, not just in her region in Kolkata, but nationwide in India to be in this business. It was a primarily male-dominated industry. She self-taught herself and quickly elevated to the position of getting to the top agent rank in the region, not just the top female agent, but just overall. And this is a hard thing to do. Anybody who knows about selling insurances, it's a lot about network, and she did not have any background in that, so she built everything from scratch. Then she moved on to the next journey of her life, and her two daughters on the left, that is me, if you can recognize the similarities. This was an exciting chapter, but with the birth of my younger sister, Ritika, unfortunately, there was some issues with the birth. She was born premature, so my mom had critical health conditions, and this was the earlier symptoms of fibroids in her uterus. But she kept powering through it. She was juggling her work and her personal life, and her mom had, if I may, really, really well. And she continued to thrive in her career, as well as being the most amazing mother to us. But in 2011, the doctor said that she really had to have surgery because the fibroids were getting worse. So she had to go through a hysterectomy. And this was a really difficult stage of her life because even though thankfully the surgery went really smoothly, she did not have access to a lot of support afterwards. The technologies were not there, they were not accessible. And it was also hard, not just for her physically and mentally, but also for us as a whole family, because we felt helpless and unable to help our mom. And my mom is not alone. There are approximately 9.6 million people worldwide who have undergone a hysterectomy by 2019. That's a pretty staggering statistic, and it does not have to be that way. If there was an earlier diagnosis, it wouldn't, a lot of times these cases wouldn't escalate this bad. So this is, I shared this to say that this is my why. This is why I care about FemTech, because I truly believe that these type of technologies, these companies, these founders are going to be the ones to break a lot of the generational barriers and provide the empowerment back in the hands of women, not just through health, but also for their economic empowerment. By the way, this is a recent picture of my mom. She is absolutely still, pardon my French, kicking ass and doing amazing. So she's definitely a huge inspiration for me. Thank you for that introduction, Michelle, and thank you so much all for having me today. Again, I'm super excited to talk to you about kind of the venture capital space, FemTech, and especially menstrual tech. My name is Sujita Ghosh, and I'm a venture advisor and ecosystem builder. So for the past 7 years, I have been working in the venture development space. So I work with early stage technology companies and help them build, scale, and position for equity-based investments. I am not a FemTech expert. However, because I care so deeply about this topic, about this industry, I have educated myself so that I can best serve a lot of the founders that I work with who are FemTech founders and be able to help them be successful. I am also an ecosystem builder. What that means is I believe in the power of intentional community building. Founders need the infrastructure and support to build successful companies. So that is something that I focus on a lot as well. So before we jump into kind of the tips and tricks for founders to take away on fundraising, it's important to talk about the importance of FemTech and the why now presentation. But we are already late to the game. It was only in 1993 that the US FDA ruled that women must participate in clinical trials. If you think about it, that is just about 30 years ago. So we are already have a lot of catch up to do. Secondly, lack of awareness. So if you've noticed, it's only until recently that period and period care companies are using the actual color of blood in their advertisements. It used to be blue ink before. I intentionally used the image that I did in my title slide because it's important not to sugarcoat the issue. It is important to see and get legitimate education. The issues that a lot of these founders run into is that a lot of the terms, whether it's menstrual health or sexual health, is actually flagged. So when they're trying to put out educational content, for example, they have to find ways around, instead of saying ovulation, saying cycle, or instead of vagina, saying vulva. And that is just not okay because it does not provide the accurate information that women need. It's statistically known that the average woman still struggles to fully understand all the different parts of their own body. So it's not just for investor education, it's also for consumer education. And if I may just rant for a second, the hypocrisy here is that with men's sexual health, which also is extremely important, but it's hypocritical because there you can see ads for erectile dysfunction and other things which are not flagged as much as it is for women. So that is an issue. Need for funding. So I'm going to drop a lot of stats on you all today, but so although women make up for 50% of the population, only 1%, about 1% of healthcare innovation funding beyond oncology is invested in addressing female-specific conditions. So we are catching up on time and we don't have enough money. So this is where the status is right now. However, it is not all doom and gloom. According to PitchBook, the investment through venture capital in FemTech is increasing. From 2020 to 2022, it has increased by 6%. So that is good news. However, it is an interesting trend that 65% of this funding is going towards fertility. And I think that it's important because, reproduction rights and having couples who want to conceive is extremely important. But I take a stance on this that women are more than their ability to reproduce. So I hate to do this roller coaster on you where it's like good news, bad news, but that is where we are at. We are making a lot of progress, but there's also so much work to do. So there is a need for technologies in addressing different issues beyond reproduction, because we are more than just our ability to reproduce, especially in the menstrual health space, as well as other. So let's look at some companies, right? And again, the good news here is that there are amazing companies doing a lot of good work, who are shattering stereotypes, who are breaking the barriers, who are having those taboo conversations. Many of the champions that I've seen this morning through these presentations, and they're building great companies. So in the last few years, we have seen the rise of menstrual tech innovations within female healthcare innovations. I said innovations twice. That's okay. All right. So the first one that I have kind of been following and looking at is called Avia. It's a digital health company. Alexis Ohanian, one of their supporters, mentioned on LinkedIn the need for FemTech companies to actually be run by female founders, because again, going back to that need for understanding the problem, understanding the consumer need is very important. Avia has stood out because they have been super user friendly and user engaging their users through their menstrual cycle and providing education. They have raised $2.5 million, I believe, in their seed round, and are gaining a lot of traction. Another one that I really like is August Period Care. Their founder, Nadia Okamoto, is also a content creator, and I love what she's doing. She is targeting the Gen Z audience, and she's absolutely breaking any kind of taboo conversations that you can think about. She got into a lot of heat for actually showing real blood in one of the advertisements, but I think that's the exact kind of thing that we need. So if any founders are looking for marketing, branding advice, I would recommend following them. And of course, Sanicle, thank you guys so much for doing all this hard work in putting this conference together. I have had the honor and pleasure to be able to work with the Sanicle team closely on their product, and they're onto great things as they further into the market. And there's also a lot happening in the menopause space. Peanut is a company that is app-based, that is helping women through their menopause. But some of the barriers that these founders are running into right now is, so FemTech is cyclic, right? So we are moving from, say, from the period to menopause to others. And the problem with that is that it's hard for consumers to change from app to app. There's a lot of marketing costs. The cost of acquiring a customer goes up for these companies. So currently, these are the type of challenges that companies in the menstrual tech space are facing. The second one is a lot of them are targeting employers as their customers, and I think that's great. But we are seeing an issue where employers are hesitant about putting money in this technology versus, say, with fertility, because fertility is addressing more of the holistic employee base. But I challenge and I ask the question that it has been when is it our turn, right? It is important that even if your technology that you're using in the office is catering to 50% of your employee base, it is still important. So I'll be curious to kind of stay on these trends and see how they're going. If you all have any questions afterwards, please let me know, and I'd love to jump in more into them. So common barriers for FemTech founders. So the biggest one is, unfortunately, in the investors in VC are 8.6% are women. So that's a very, very small number. So most of the times when these companies are talking and pitching to venture advisors, there is a lack of investor awareness about the problem. The most important part of a pitch is to be able to understand the problem, to understand there's a need for it, to understand there's a big market for it. But unfortunately, because founders are having to spend so much time having to educate the investor about the problem, they're not even being able to get to the part about what the product does or what is the return on investment. So some key takeaways for any FemTech founders who might be listening. So the first one is creating that awareness. I know it's frustrating to spend this much time on educating your investors, but take it almost as like a branding strategy. Do a lot of customer discovery, really understand your customer's problem, and also educate your customer as you're educating your investors. The second one is, traditionally women have been maybe known to be more combative than collaborative, but that is changing, and that needs to change, because in order to make a difference in this industry, FemTech founders have to stick together. So I encourage you to find a FemTech innovation conference near you, attend platforms like this, and network with fellow founders, so you can create more advocacy for investor investment. This is my favorite part to talk about with all companies, but especially in FemTech. But in your early stages, venture capital funding can seem sexy, but not all money is good money. You want to be able to retain ownership of your company for as long as you can. That increases the valuation. That de-risks a lot of key components, so that when you do go to institutional investors, you have more negotiation powers. Again, I think I'm running out of time, so I'm going to go through a little quickly, but please connect with me afterwards if you want more suggestions on where to look for non-dilutive funding, which essentially means funding that is not equity-based. And then the most important thing is, when you are ready to get to the investment pitches, to get to investors, to find investor value alignment. And I ran upon this golden video that I want to take a second to show you all, to show exactly what I'm talking about.
Never done that. I've always tried to be right. I make $1 off each one. If I sold 7,000 yesterday, I made 7 grand.
I can't get involved with you because there's not enough margin for me as a distributor. I need to be able to sell it for $12 at least, so that I can make some profit and you can make some profit, right?
Yeah, but you're selling to farmers.
Okay, I get it, but I'm exploring where your head's at, all right?
Okay.
That means that there's no room in it for a distributor that can really scale this up. Now, who's going to pay them, Johnny? Who's going to pay them?
I'm out.
Johnny?
Yes, sir.
Farmers are the cornerstone of America. There may be a lot of farmers out there that can't afford $12 per tree, but maybe they could afford $6 or $7. I'm going to give you everything you're asking for, your $150,000 for 20%. What you're doing is right, and you deserve the chance to make it big and do a lot of good. I'd like to be your partner, Johnny. I like everything you stand for, man, and I like everything.
Oh, I just get goosebumps every time I see that. But this is a perfect example of the importance of finding the right investors who are aligned with your values and who want to grow the way that you want to. There's a lot of pressure for companies to grow quickly, to scale fast. The other sharks here, they were not incorrect. They were right that if Johnny increased the margins, his company would be scalable quicker, be able to grow bigger, but that is not where his values were, and that is okay. So be patient, find the right investors, find the right strategic partners who align with your values. And then lastly, I just want to say that I threw in a lot of real stats today because I want founders to be prepared for what is happening. But it is so important, and I encourage you not to give up, because there's 3.9 billion women who need you, who need your innovations. Women like my mom, myself, our moms, our daughters. So please don't give up and keep at it. Here are some resources that I'm happy to share afterwards as well. Some podcasts, newsletters, some strategic venture capital firms that you can look at if you're growing a business in this industry. And yeah, that's all. I will take any questions if you have any. I'll put up my thank you slide so you can see my contact information. But Roxanne, Chase, if there's any time, I'd love to answer any questions.
Well, thank you, Sajida. So far, I don't see any questions in the chat. However, please drop your questions at any point that you have them, and definitely reach out to Sajida. Google the name on LinkedIn, click on the link, and connect. And but everyone said it's a super helpful presentation. So just know you did excellent job. Excellent job.
Thank you, Zakira. Thank you for the opportunity.
Yes. Thank you as well. All right. And so now we're switching gears. Hi, I'm Zakira. I was the former interim CEO. And so we'll get into that a little bit later. So we're giving our lovely Michelle Simmons a brief break. And while we do that, I'm going to move right over to the next speaker. And the next speaker is Deepa Subramanian. And she is the drumroll. She's originally from Tamil, India.
Can you hear me?
And let's make sure that we're properly. There you go. I can hear you. All right. So let me give you a warm virtual welcome. So Tamil Nadu, India. I said it right, right?
My name is Deepa Subramanian. So I'm from India. But yeah, thank you so much for having me here. I had just a little bit of hiccup on my audio, but I will get started right away. Hello, everybody. Welcome to this talk. I don't know how many of you are in the tech space. My name is Deepa. I will be talking something totally different. So this is not a super tech talk, but then I'm going to be making it very easy for you. So we're going to see how we will be using how to use app sheets, no code resolution, and AI to address endometriosis in menstrual health. So first off, my name is Deepa. I'm a Women Tech Makers Ambassador. I'm also a Google Developer Expert in web technologies. And I just, I'll share the LinkedIn at the end as well. So, okay, first off, why am I even talking about this, right? So I'm an Indian woman. I came from India. I'm Asian. I'm brown. All those things are there. And why am I talking about this? This is a very, very personal topic to me because I suffer with it. It is a lot that I went through and I still go through, and I hate it, totally loathe it. So it is something that nobody talks about. You can't talk about it very comfortably at workplace, or even you cannot even talk to your male boss saying that, hey, I'm having cramps today, right? So those are some of the things I really suffer with it, and I don't like it. So I want to build this awareness. Thank you, Chase. I met him in Google Cloud a couple of months back, and last month back. And then he gave me this opportunity. Thank you so much for giving me this and making me speak at this event. It is an honor to be here. So as you all know, these are the products, right? We all use menstrual pads, menstrual cup, tampons. None of these work for me because one, I have eczema. Two, the plastic layers on those freaky pads does not go well with my body. So I have to use either a cotton-based pads, or most oftentimes I have to end up using adult diapers. So that's something about it. So first off, to begin with, for men around here in this space, if you don't know what is endometriosis is, it is nothing but a tissue that resembles very similar to the lining of the uterus, but it grows outside of the uterus of a woman, right? And it can attach to itself in the pelvic areas, abdominal organs, and it causes lesions, adhesions, and of course, cysts too. So how many women suffer with it? There are more than 1 in 10 women suffer with it. About 176 million women worldwide suffer with it. And most often, how I got to know that I have endometriosis, I did not have the beginning of my period. So after the birth of my son, I'm in the US. I was not too sure. I was talking to my doctor. I said, hey, you know what? I'm having very heavy periods after this. And all they did was by the time, all they gave me was birth control pills to, subside your flow. And most oftentimes what happens is people who suffer with it, they don't even know. So they are underreported. There's no non-surgical or non-invasive method to cure this. So, or even to, alleviate this issue. And there are 3 stages. I am somewhere on the severe side. So there are four stages, minimal, mild, moderate, and severe. So if you see on this picture, these yellow stuff, they are starting to have those fibroids too. So I know people have cysts. I do have ovarian cysts. And then it's because of this, it's gotten worse and worse and worse. And, there's no cure for it. And they keep giving me birth control pills, which I don't want to take because there are other implications of that. So there are other side effects having that too, right? So what are the symptoms generally women go through? The cramping. It's really, really bad. It's before, during, and after, around the 5th or the 6th day period too. and you have heavy bleeding for me, it's about 2 to 3 days. It's very hard. There's very heavy bleeding. So even when I'm driving to work, I have to make sure that, I have a towel in my car seat. So that's the worst part of it. So the reason why I'm talking about this is it could be so worse that you can't talk about it at workplace, or you can't say this. It's something that's a taboo that people don't talk about it, and you can't take a day off of it. Or how long would you take, right? Every month you can go and ask your boss, hey, I need to take off because I'm having cramps, right? Or I'm having a heavy period. So you got to live with it. And then what happens is because of this, it spreads out, and you also have a very heavy bloating as this condition kind of went through me, and it's been over about 10 years now. There's bloating that you would see. It's very hard, and you can't eat anything. There's also other stuff that goes on to it, and it stays for a very long period. For me, it's an 8-day cycle. It starts off as spotting, and then it's maybe, may not be, and then there's boom. It gets worse. So it affects, it has an effect on your these things have an effect of your mental health. Physical health is, I do workouts on these days. I cannot go for workouts. And then reproductive, people are having issues with getting, conceived for a baby. So that affects it. And emotional mental health. It is really, really irritating. And I get very irritable. Sometimes I cry. Sometimes there's a mood swing that goes on to it too. So some of the things that you would see is, you need to also see how do you prevent it. Or there are times that when you have this, you cannot travel either. So there's hygiene and infection. You have to make sure that you don't get any UTI. And social implications, like I said, you cannot talk much about it. People don't talk about it from where I come from. And having this birth control pills is a nightmare because it did not work out for me. It kind of led me to, I could not have my second child because of this too. So that's something that I had to go through. So now we talked all about endometriosis. Let's take a detour and talk about how do we build something in and how do we use AI and AppSheet to see how we can build a tech around this, right? So let's take a detour. AppSheet it's a Google's application platform that allows you not only mobile apps, it allows you to do mobile apps, desktop, and tablets too. So you can create an application, but the best part of it is when you create an application using AppSheet, you're using all the Google Workspace stuff, right? And you can also connect it to Google Cloud, and you can deploy it as well. So the features of AppSheets are you don't need to know how to code. If you know how to type, that's all you need. So you don't need any you don't need to know any code. So you can use a spreadsheet like an interface to create mobile or web application, and you can integrate it with Google Workflow. Everybody knows how to use Sheets, Drive, Forms, and you can allow users to leverage whatever data that is already there, and you can use that workflow and automate this process too, right? So if you know how to use Google Workspace for at least a little bit, then it becomes easy. So when you do the automation of any business process, you can work with notifications, approvals, alert-based predefined condition. If you want to say, hey, you want to alert your period is about to come, right? All those things, you can do that. So, and also you can connect data, right? Because I said that you can connect it to Google Cloud. You have Google Cloud's infrastructure around you, and you can create databases, spreadsheets. You can also have APIs around. You don't need to code at all. You just have to work in a spreadsheet-like interface, and you can do all of these things. And some of the and also it has offline support. So when I talk about offline support, even if you're not connected to the internet, and when you come back, the data syncs automatically, and you can get your data restored, and it works seamlessly in a production environment too. So these are some of the features of AppSheet. Like I said, AppSheet, you can data. From where do you get these data sources from, right? Sheets, you could use Excel, you can use SQL database. If you're not familiar with it, use Google Sheets, structured query language database, and then you can build apps. You don't need any coding experience, right? And what kind of apps you can build? You can build a tracking, inventory tracking, project management, data collection. In this case, why I'm mentioning tracking is there are some amazing applications out there, but it's not built off Google AppSheet. But then there are very similar applications. If you see, there is Flow, which is a period tracker. And then there's something called as period tracker, period calendar. And then this is cycles period. And I use this. It's a period tracker too. It's the name of this app is period tracker. And then there's something Clue. There is no specific application for endometriosis. These apps are mainly for period tracking. So I use period tracker, what it gives me is the main thing that I use it for is the flow. If you see there are symptoms that you can add on to, you can see there if there's, I mainly put it as spotting, if I have headaches, body pain, back pain, and then also how is the flow, right? Those are the things that I see. And also there is a mood tracker to how are you feeling today? So most oftentimes I get irritable during the third or the fourth day. That's one other thing. And you can track it. It also gives you, it also comes along with ovulation and other stuff too. But note that most of these applications or apps out there just have, it's either combined with ovulation or just the period tracker. There's nothing that says that, oh yeah, you have a heavy flow. But if you have a trend of it, I did not know that these kind of apps existed before, because this was, I'm talking about in 2008, right? So I started having, all these issues starting from 2008. It was hard for me to, even talk to the doctor about this issue. So that's, and what, now we talked about AppSheet, we talked about endometriosis. What you could do, right? You can create your own endometriosis symptom tracker. Okay, how do you do that? It's super simple. There are only three steps that I'm going to talk about. One, you go to appsheet.com and you click on, I have a video of this. If you have time, I'll play the video. Otherwise, you can go watch the video. I'll leave the slides here so that, but this is the process of it. So you just have to go to appsheet.com. And then you click on this button called as create a new app. In this case, there is no health. Even in this, there is no health related app. So you just have to click in other, and then you can create the app, right? The second step is you need to create your own database, right? So it's again like a spreadsheet-like interface. There's a lot of tutorial in Google Workspace. If you go, I just put in my name. You can create it for you can also have a login page people can log into, and then you can collect those username from there. I just basically created, put few information about my period in the month of April. So if you see that my name, there's date, and note that it has a specific data type. So if you are trying to use a option, for example, you have pelvic pain. So how big of a deal for you is it? So if I click onto this, it says, it gives you options as no pain, mild, moderate, and then severe, right? These are called as enum data types. If you see here, it shows here, right? You can create a list, or you can create it's basically nothing but a drop down options, okay? It's a fancy word for that. So you can create this, and then based on this, you can query. So now we have to switch gears to AI, right? We are creating the data this way, and then we'll have to talk about AI, right? Today, everything is AI. Anywhere you go, it's been hyped up, right? And for you to use AI inside of AppSheet, you know they don't directly use this AI. When I did the demo, when I created this app, they had it as a model, which is related to machine learning. So now the question comes to, what is machine learning, right? It is a field of AI that focuses on creating algorithms that can learn from the data without being explicitly coded up, right? So when you create those Excel sheets, you are creating your own data, right? And these are there. If you go, I created an app called a symptom app. And then if you see here, this is, I did not deploy it. Before deployment, I used this feature called as intelligence. And if you see, it's using a predictive model, right? So you can create ML, machine learning model using this. And if you have, in my video, I'll be showing you an error as well. If you have any records that is less than 25, it cannot predict. So it needs to collect the data over time. So you basically click on the intelligence and then go to the predictive model tab. And boom, my period tracker is ready here. So if you go here, it can also support mobile, tablet, and if I can play this video, I will play it. Otherwise, you can take a look at this.
So this is a small demo that I wanted to show as how to use AppSheet. So when you go ahead and click this create button, you can create an app. So basically I have two apps here. One is deployed and the other one is a prototype that I try to play with it. So the symptoms app, if I go, and here's the data that I created. This is a database where you can create, the rows and columns of it. And the username is a string type, and then date is date, and then time is time, data type. And then like if you see, this is a option one. So if I click on this, this is the enum type. So you can create options where the users can pick and choose from. So like Anna, you don't have to write any code for this, and you can also query based on this too. So here I have no pain, mild, moderate, and severe. And I also have similar enums for menstrual flow, bloating, if it's present or not. You have regarding cramps, whether you had no cramps or intolerable ones. And then mood swings are present, if it's present or not. So you can pick and choose from different data types here. If I go click on this, for example, if I go click on this, it asks me the whole number of options here. You can look at the data, you can look at the documentation to see more details about this. So once I deploy this app is deployed, so I told you that if you click on the intelligence, it says that there is an AI tracker. And note that it also says that it cannot train this predictive model because it's got fewer than 25 rows. So that's why it's not able to predict here for our symptoms tracker. And the app is deployed. And if you go click on this here, you can see this is for the month of April. So I can go back to April and you would see all the details. And you could note that you can also change the colors. I didn't do that. But this is how you can create your own application. See that it supports mobile, tablet, and desktop too. So that's a small demo that I wanted to show.
So just in summary of all of these things, I hope you were able to hear that video. Otherwise, I can send you this information. There's also a YouTube link in there, or you can go check it out in my YouTube channel. So in summary, right? I just wanted to say that people get delayed in diagnosis of, I picked up these stats from some of the websites. So it says that there's a delay at least by 6 years. People don't even, diagnose this earlier. So the second thing is there is 6 hours of lost work productivity per week because of endometriosis. Like I said, I used to suffer every single month, and it's very hard to stay up and sit on. If you're working on a sedentary work, if you're looking at your computers, it hurts. And for in the U.S., about $45 billion is lost during because of this and due to absenteeism, right? And then it's an economic burden, right? About 69%, $69 billion of economic burden to the U.S. Having said all these things, we are losing this much of money because of absenteeism, and then people are, taking time off because of that. The productivity goes. Despite of it, there's only 16 million, and it is not also for endometriosis. Okay, it comes in general health. They mainly focus on how the previous speaker was speaking. Most oftentimes, it goes to the research money goes to either ovarian cancer or cervical cancer or breast cancer, not for funding for endometriosis. Very, very small amount. So this is something that I wanted to put it up there. This funding is for 2023, but in 2019, this was half of it. So 7 million only. So understand that this is how, women are, there's research money is going for women around this space. So I just want to end it up saying that menstrual health, hygiene, and health is a human right, and it's not something to be ashamed of. From where I come from, it is a taboo that you cannot speak about it, you cannot talk about it. But I want to make sure that people are aware. It's very hard to go through this, and I want to end it up at saying thank you, Chase, and all the entire Sanicle team for giving me this opportunity. Please connect with me on LinkedIn, and if you want to read up more on the references that I picked up on, you can take a look at this too. Thank you so much for having me here.
Thank you so very much. And thank you to our previous speaker as well. We are going to go on to our next panel. It is moderated by Priscilla Siwela, featuring Olive Kabia, Ayana Gardner, and Lesiana Emakoa. Priscilla is a driven individual who works as both a Splunk engineer and a mental health therapist, dedicating her time to helping people overcome depression. She is involved in a Menevia Forum and the Houston City Council District J. She is passionate about getting back to her community and uses social media to raise awareness about social issues, including menstrual health. Olive Kabia is a dedicated change maker from the Democratic Republic of Congo. She was recognized as a global youth leader for 2023. She works as a legislative assistant in the Maryland Governor's Office, is involved with the United Nations Department of Global Communication, Civil Society Outreach. She is a force in the global community advocating for positive change and social justice. Ayana Gardner is a customer experience technology leader at Zoom with 13 years of work in telecommunications, cloud services, cybersecurity, and AI-driven software. Ayana plays a critical role for the IT partner community by helping them understand the newest innovations in customer experience software and enabling them to offer it to their customers around the world. And finally, Lesiana Emakoa, originally from Cameroon, is the USA Country Director at Hallmark International Youth Club. She also serves as monitoring and evaluation specialist at a community action agency in Washington, D.C., and as a project manager and gender specialist, the Climate Change Forum Network in Sierra Leone. Lesiana is also the organizer for the 2024 local conference of Youth Sierra Leone.
Thank you so much. Can you guys hear me? Let me see.
Yes.
Yeah.
Oh, you just went on mute. Okay, now you're good.
Okay. Thank you so much, Sanicle US, and thank you so much, Malu. My name is Priscilla, and I will be moderating the panel on Gen Z, like the hurdles that the Gen Z women are facing in the workforce area, and cover actionable strategies for cultivating inclusive environments that empower Gen Z women. So our first speaker will be Miss Liziana. I think she is here. Oh, yes.
I'm here. Hi.
Hi. So, Miss Liziana, what inspired you to start the Center for Community Impact and Sustainability, and how does it support Gen Z women?
Yeah, absolutely. Thank you so much for your question, Priscilla. And first and foremost, I would like to thank Sanicle as well as Chase, for the invitation and for the opportunity to be part of this esteemed panel. So my inspiration to start the Center for Community Impact Sustainability, as well as getting involved in the development space, came from witnessing the untapped, potential of young people, particularly women and girls who had, brilliant, innovative ideas, but lacked the support, to bring them, to fruition or even to the implementation stage. So some of our initiatives, enables to bridge, the gap, by providing resources, mentorship, sustainability, and projects and entrepreneurial skills, especially like in the continent, because that's one of the main issues for young people, like the needing access to jobs and skills and training in different sectors, that are respective to them, and also helping them transform, the ideas into impactful community initiatives. And that's a lot of that is also through some of our capacity building that we started throughout the implementation. So we also educate them on how to advocate, we educate them on the sustainable development goals, the 2030 agenda, the African Union 2063 agenda, and also how to advocate at the multilateral stage, because a lot of young people in the continent, especially those that are marginalized, in order for them to amplify their voices in multilateral processes or at the global stage, they will have to be educated about what is SDG 1, what is SDG 2, what is SDG 3, and many of them, and how do you do the intersection between the work that you do at the grassroots level to the sustainable development goal. For example, you can be working on food security, but then how do you connect that to SDG 2, and how do you break down the different targets, right? So we help them with that. And I also understood the importance, I personally understood the importance of addressing systemic barriers, including gender-based violence. A few years ago, I had the opportunity to travel back to Cameroon, to the continent, for the first time, because I came to the US when I was 14. And that was like back in 2018 or 19, I believe. And I had the opportunity to organize a health campaign in one of the local communities of Yaoundé, at the outskirts of Yaoundé, which is the capital of Cameroon. And in partnership with one of the local doctors, it was like a local doctors organizations, similar to that of like, Médecins Sans Frontières, Doctors Without Borders. And and there, and I also during this project implementation, I observed that for the first time that many of the adults and girls in those communities did not have access to reproductive rights, education, including even how to calculate their own periods, and which as a result has led to early pregnancies, when as a young girl, not even knowing how do you even calculate your period, how do you know when your menstruations are coming, and also how do we even provide those type of education or connect them with local partners that are on ground, right, to provide them with those opportunities, that reproductive rights education. Second, and we also know when there's early pregnancies, it exacerbates school dropouts, especially amongst young girls, right, when girls are pregnant at an early age, they have to drop out of school. In addition, we also observe the issue of internally displaced
the issue of, internal displacement amongst, for the women and girls, from the Anglophone crisis, for those that are familiar with the ongoing civil crisis that has been happening in Cameroon between the Francophones and the Anglophones, especially in the Anglophone region. And a lot of the women, are from that region are displaced in the main capitals like Yaoundé and Douala. And we observed that a lot of them lacked basic hygienic supplies, which results in also them having low self-esteem, and also leading to mental health. Because imagine when we think about women living in displaced camps, and imagine when they're on their period, like they can't, it's like if you're on your period, you don't really have the adequate sanitary supplies. You're not really that comfortable. As a woman, we should understand that. So how and then for me it was like, okay, how can I actually start tackling some of those issues? So I also talked about education earlier. In many rural communities, girls that are also on period, they're not also able to attend school, so leading to low school attainment. So how can we address, water and sanitation and even issues in schools? That was also some of the issues that we identify in rural communities, when there's no school, also depending on the societal norms, the gender norms, the religious norms in that community. Some families are not comfortable with their girls attending school. So how could we start, addressing or tackling some of those issues? So as part of my work as a gender expert was to ensure, that some of our interventions are gender sensitive and gender responsive. And we also wanted to create awareness and to bring greater visibility about, the issues at hand. So that's how we're able to come up with sustainable approaches, to tackling some of those issues. And some of the work too that we did was also on we also carried out some smart agriculture. Currently, we're currently working on smart agriculture, approaches or initiatives, also in terms of like just empowering, young women and girls in general, and educating them and seeing how we can connect them with the funding, with financing, with loans, and ensuring that they also are eligible for those loans, because we know what's happening in the continent, or even in the global south in general, how a lot of women, they can't take loans because they don't have access to land, they don't have access to legal services, so they don't really own lots of loans, so they don't really have collateral. So how can we be the bridge for now, between, providing those resources and educating women and connecting them to the right strategic partners and key stakeholders on ground? When I'm talking about the private sector, multilateral organizations, and even local governments. So yes, thank you so much.
You're welcome. Thank you so much, Miss Luciana. So I have one more question. It won't take long, just 1 minute. So what advice would you have for Gen Z women looking to make impact within their sector or within their communities? What advice would you give them?
Oh yeah, thank you so much. So the advice that I have for Gen Z women, and that's something that I do. So first, already having a vision board each year at the beginning of each year, right? Starting your year with a vision. It could be a short-term vision board or quarter, setting quality goals. As a monitoring and evaluation analyst, it's, we do a lot of quarterly evaluations, right? And how do you, and being able to, because if you have everything on board and you write down your ideas and the things that you want to address, or things that different goals that you want to achieve, it's definitely going to help you. I don't know about everybody, but I'm a strong believer, and I believe that anything that you write down, comes to pass, and you're even able to easily monitor it, as well as networking, right? Being able to advise them, to be able to network with others, who share their passions, right? And also seek mentorship, mentors who can guide them, mentors, identify strategic mentors in their field, and also take advantage of technology. And this I'm mostly referring to the Gen Zs, especially those in the continent, taking advantage of technology to amplify their voices and to be able to reach wider audiences and to be able to reach social media. And also be persistent, don't give up, don't be discouraged. Don't, all the no's that you're getting, don't let it discourage you, or all the challenges, don't let it, take you down, if that makes sense. And most importantly, believe, in your ability to be able to create change and be enthusiastic, and as well as be able to, how do you be able to leverage your strengths, right? Identify what are your strengths and see how you can take advantage of it. And I'm going to conclude with this last thing. And I work with a lot of young people, and I've had the opportunity to mentor young people I'm also an executive director for a youth-led organization called Hawa International Youth Club. And one of the challenges is a lot of young people do not have access to passports, or when you go into these spaces, right? How can you create impacts in your communities? A lot of the young people that we mentor, we try to bring them to the UN spaces, to different global international conferences for them to be able to amplify their voices and talk about the projects that they do on ground. So always be passport ready, because you never know when that opportunity will come for, we have a conference for you to come up, there's a fellowship for you to come, and literally we need you to, like, the funding is here, but you don't have your paperwork. And lastly, your proposals. When you go to each meetings, each conferences, or whatever, make sure that you have your proposal, like for whatever project you're doing or concept note, because you never know the next funder that you're going to meet. You can be having a project on children, you can meet maybe someone from UNFPA, UNDP at that meeting. And if you have your projects and your proposals already at hand, right, you can just have a QR code. Okay, I'm ready to share it, I'm ready to email it, and be versatile. So that's what I'm going to, that's the advice that I have for Gen Zs. And also be humble. So yeah, stay humble. So thank you.
Thank you so much, Ms. Liviana. You can put your socials in the chat so everybody can follow you. And also, if they need more information, they'll come to your DM.
Thanks. Appreciate it.
Our next speaker will be Ms. Ayana Gardner. So, Ms. Ayana, I have two questions for you. The first question will be, how does Zoom address the unique needs and challenges of Gen Z women within your corporate structure?
Yeah, definitely. And just to be clear, I'm not Gen Z, I'm a millennial, so I'm going to answer as a millennial. I hope that's okay with everybody.
That's okay.
So Zoom has a lot of different tools, resources, and organizations. The main one being ERGs. Everybody knows of that solution, but ours are very active and they're very niche as well. So we have one for women, we have one for Black people. We even have one, I think, for like Marvel Universe kind of fans. So they have all sorts of different groups that helps you feel like you have a community, because it is a bigger company. It's small compared to some other companies. It's about 8,000 people. But yeah, it can feel very, isolating, especially because most of us are remote. So if you're just at home on your laptop 40 hours a week, it doesn't feel like you have connection. It doesn't feel like you have community. So the ERGs are super helpful. They typically meet a couple times a month, and then you can get on a chat with everybody. Similar to like this, we can have discussions. And then they also have a lot of resources. Like, I don't know if a lot of people know this, but Zoom offers unlimited book stipends or expenses for their employees. So any book that I order, I can expense it to Zoom. I think the only parameters, it just has to be appropriate. So use that to your imagination. You know what that means. And then I don't think we can order like religious books, but anything outside of that, if it's self-help, if it's anything, for dieting, meditation, like there's so many books that have a lot of knowledge that I think, Gen Z and millennials can benefit from. So that is one benefit that I love and I take advantage of every month. And then another one is they offer for women, they offer free freezing of eggs. So you just have to get a note from your doctor, and then you go to the fertility center and they set everything up and Zoom covers it wholly and fully. So those are some of my favorite ones, but they have a lot of other ones, and it's just really a great company overall.
Thank you so much. The next question will be, if anyone has any questions, please just put the question right now in the chat so I can ask Miss Ayana before I get to the last question. But the next question is, how effectively, like, can Sanicle partner with Zoom, especially working with corporate and government employers?
How effectively can they partner with them?
Yes.
I mean, we have decision makers that you have to speak with and see if there's any synergy on, you know, goals that Zoom is trying to reach that you are also trying to reach, and then you guys can kind of work together. And I'm happy to make any introductions, you know, based on any initiatives that you guys have. But yeah, Zoom is very active in all sorts of communities, and we have something called Zoom Cares. So they are very active in donations and things of that nature. Right now, I think for sponsorships, they're more focused on, just because everybody knows Zoom video meetings, but we actually have over 30 different products. So right now they're just trying to get the word out about all the different products that we offer. So that's kind of what my role is, really.
Oh, okay. So somebody asked if there's any menstrual benefits.
Menstrual specifically, I just know the egg freezing one, which I guess kind of ties to it. But anything specific, I would have to do a Google, or ask my HR department. But yeah, I can't think of anything specific to menstrual. But the previous speaker, the lady who spoke before our panel, she was talking about the Flow app and things like that. I am a big fan of those apps. I didn't use those until maybe 2021, and it makes a huge difference just being able to know when it's going to come, you know, which one was heavier, you know, if you missed one, things of that nature, because, you know, those 28 days, they go by fast when you're regular, and it's just like, wait, did I already have it this month? And then it's so easy to just go to the app and have that information.
Yes, that is so true. I also use one of those apps because every time I always like mess it up. I want to know, and when it comes, I'm not ready. But with the apps, it really has made a huge difference. That
Yeah,
is so
exactly. It's like, should I wear white today? Let me check the app.
Thank you so much, Miss Ayana. So can you please put your socials in the chat box so people who have more questions can get to you, and also so you can give us feedback on the menstrual benefits that you say you asked the HR or something like that. So
yeah, definitely. You can find me on LinkedIn, just my name, Ayana Gardner. I don't think there's that many of us, so I should pop right up. I have like a pink background. And then I actually have a website. It's called blacktechglobal.com. You should check that out if you're looking to get into tech and, you know, what conferences are happening all over the world.
Okay, please just put it for us in the chat box.
Okay, I'll put in the chat.
All right, thank you so much, Miss Ayana. So our next speaker is Ms. Olive Kayongo Kabeya. Ms. Olive, thank you so much for joining. Our first question will be, how does the MD Governance Office approach creating inclusive policies for Gen Z women in the workforce?
Thank you so much. I'd like to start by thanking Sanicle for this opportunity to speak about the subject that is, you know, not only timely, but also deeply relevant to the future of our workplaces. And as a legislative assistant, the Maryland Governor's Office, and as a Gen Z myself, I'm truly honored to discuss the initiatives and strategies that aim to empower Gen Z women, enhancing workplace dynamics across the various sectors. In the Governor's Office, we recognize the power of education and training in leveling the playing field for young women. We support the program that encourages the pursuit of education in high demand fields, particularly in STEM. I know most of you might be wondering why STEM, because simply these are the fields that will shape our future, and we need women to have a seat on the table. And by providing scholarship and partnership with educational institutions, we are opening doors that were once closed, ensuring that Gen Z women are equipped with skills and necessary skills to excel to the 21st century job market. But knowledge isn't enough, right? And that's why we're also investing in mentorship programs. And these programs connect young women with experienced professionals who can offer guidance, share wisdom, and help navigate the often complex career landscapes. Those mentors create a bridge between generations, facilitating a transfer of knowledge that goes beyond textbook and classrooms. And it's all about the real world experience and shared human connection. And we do recognize that despite these initiatives, we must acknowledge that there's a lot of challenges that Gen Z workers face in multi-generational workforce. And one of the most persuasive issues is the battle with generational stereotypes. And it is not uncommon between millennial and Gen Z workers to confront the misconceptions regarding their work ethic or commitment. And such stereotype can definitely create a barrier to the understanding and collaboration, hindering the potential of our youngest generation. And so we ask ourselves the question, how do we overcome those challenges? And I'd say first it's by encouraging intergenerational dialogue and collaboration, and so that we can dismantle the harmful stereotype by showcasing the achievement and contribution of Gen Z. Also highlight the value of our generation, the value that we bring in the workspace. And recently, for example, I've gotten the opportunity to occupy the position of youth reporter during the United Nations Civil Society Conference, where, thanks to the subcommittee media that I was part of through the UNDGC, I had the opportunity to interview the director of the Outreach Division of the United Nations. And he underscored the critical need to prioritize intergenerational collaboration at this juncture, particularly as we stand to embark on a journey toward the summit of the future. So this only shows how in the workplace, Gen Z and millennials have to work hand in hand. And this is exactly what the governor's office has been doing. We've been offering programs that supports that in order to have these young women, those who are graduating from high school, those who are just graduating from college, to have that say also get started, have this powerful way to start with their political careers, etc. And I think that's what we're doing so far.
Okay, thank you so much, Ms. Olive. So just a quick question. If there is people who are watching right now and they want to know more about the mentorship programs, would you please send us information in the chat box so we know where to go for those type of programs?
Absolutely. I think everyone has access to internet. You can type in dls.maryland.jobs, and then you'll be exposed to all type of fellowship and mentorship. And I have the privilege to talk about this because this is how I started. I was doing an internship last year with the legislative department, which helped me understand, first of all, what is the work, because I came from a space where I was just a college student. I didn't know about what I was doing. Also, I did have a background in legal studies, which completely was different from being a legislative assistant. So I had to learn through this mentorship program where I connected with mentors and managers that had 40 plus years of experience to kind of guide me through what it is like to be a legislative assistant. What should I do? What do I need to learn more? And I finally ended up securing a job right after that. So I definitely encourage anyone that wants to make a career in politics or any other career to simply go and ask questions and seek mentorship. Ask, who can help me? What can I do with these ideas? Have your thought gathered together and just go ahead and ask, and there will definitely be someone who's going to be able to help you with that.
Okay, thank you so much, Ms. Olive Kabea. And I just want to say thank you to everyone that shared profound information, and also as well as the links that we have to go and read more, especially for the period trackers. I'm sure it's going to help a lot of us, me included in that. So thank you so much, U.S. Sanicle. So I would like to say, Ms. Zakira, can you please take over? Thank you so much.
thank you to the amazing Gen Z panel. That was so informative. You all are so wise beyond your years, and please continue to fulfill your purpose. Now, we're taking a huge shift. It's been an amazing part of the summit, part one of the summit. This is part two. It's definitely going to get better. Part of my internet, I got lots of things going on, so you will see a delay. I want to take this time to acknowledge all of the team at Sanicle. This is a heartwarming, kind of public announcement officially in order to literally pass the baton. I want to thank the team at Sanicle for literally inviting me to be the event strategist from November 2022 with the first virtual summit, and then even my stint with being a fractional CMO or Chief of Marketing and Events leading up to being an interim CEO at Sanicle. It's been an amazing opportunity to be able to serve. It's been an amazing journey. And I can only trust and believe that the next person who is going to be receiving this baton is going to continue to take Sanicle to the next journey. And thank you all for being a part of my chapter, my story. And so now, without that being said, let's welcome our interim CEO, Michelle Simmons, who is a dedicated leader to championing LGBTQ plus humans. And she's the library director at the Oklahomans for Equality and founder of Queer Lit Collective. So she expands access to queer literature and established libraries in underserved communities. Ironically enough, this is a random fact. You're probably like, how did it relate? But my mom used to work at the African American Research Library and Culture Center. So the minute I knew that she had the library brain, I'm like, oh, we're going to get along just fine. So she is also actively involved in politics, and she promotes civil rights and engagement as affirmative action officer to the Oklahoma Democratic Party. She is passionately driven by the desire to provide an equitable social, political, and economic landscape. Let's give a warm welcome to your interim CEO of Sanicle, Michelle Simmons.
Thank you so much. I'm really excited to be here. So the topic I was supposed to be discussing today includes workplace inclusivity. The very beginning of that conversation begins with the question, what is menstrual health for the 2S LGBTQIA community? What are the daily concerns that we, either as part of the queer community or as allies, need to keep in mind as we work towards a more equitable future for our cisgender, trans, non-binary, gender diverse, and agender community? First, let's lay some groundwork. Children between the ages of 18 to 24 months can recognize and label gender groups. They can label their own gender by the time they reach age 3 and may not match their assigned sex at birth. By age 4, they have a stable sense of gender identity. And by age 6, they spend most of their playtime with members of their own sex. They gravitate towards activities that are associated with their gender. Gender expression is influenced by exposure to stereotypes and their identification with the people in their lives. The internal sense of gender identity is something else altogether. While it generally stabilizes during the ages of 3 to 5 years old, it can change later in life. Depending on their social environment, they may experience dysphoria and increased social anxiety as they age because they realize they don't feel the same way as their peers. Gender diverse children may show signs of depression and poor concentration in school, and perhaps not want to go to school at all. These aren't just stats I'm reading to you. I know this because I've experienced it. These things are true even if you are raised in the most binary of households where words outside of a gender binary don't exist. Especially when puberty hits, children who already feel different, even if they don't have the words for what they are feeling, dysmorphia and depression become increasingly concerning. Combined with societal, political, and familial pressures, 39% of LGBTQ plus young people seriously considered attempting suicide in the past year, which increased to 46% of trans and non-binary young people. 71% of trans and non-binary youth experience anxiety. 59% experience symptoms of depression. 50% of the young people who wanted access to mental health care were not able to get it, which included being afraid to talk about their issues with someone else. And let's not even talk about the laws that are in place in different states, including Oklahoma, that threatens imprisonment and hefty fines for providing gender-affirming care for trans and gender-diverse teens. These kids are joining our workforce. They are aging into a society where the political forces that be have made them even warier of seeking healthcare. Now, let's talk about gender-affirming care for adults who aren't wholly comfortable with the biological function of menstruation, what that means. So let's talk about finding healthcare. I don't know about you, but my current healthcare cost for visiting a physician with insurance is $130, give or take a few bucks here and there. Imagine that despite how much research you've done, you still have to vet your physician in person to see if they're actually gender affirming for you, and having to go to multiple doctors to find the one or two in your area that may or may not take your health insurance and will give you the care that you need. That's $130 times however many doctors that is. Then pray that they don't have to go out of network or have to discontinue care due to legislative nonsense. Many trans and non-binary individuals who menstruate may avoid visiting a gynecologist to discuss their menstrual experiences because they fear being misgendered, invalidated, humiliated, and disrespected. This is not equitable healthcare. Let's define the very basics of gender-affirming care. It's the physician and staff using their names and pronouns and not the ones assigned at birth. It's an understanding of the specific issues that trans and gender diverse individuals face. It's medical care that sees them as whole human beings, mind, body, spirit. Attaining menstrual health is a challenge for women, adolescent girls, transgender, and non-binary individuals worldwide, but it is exceptionally difficult for those who experience dysphoria and other hormonal concerns. This includes trans women and trans men. Pausing for a moment, let's touch on trans women issues, because I'm sure some of you might have a big question mark hanging over your head. Like, why do people who are assigned male at birth have menstrual health concerns? Upon starting feminizing hormones, trans women experience a regular and varying hormonal cycle. Little research has been done on this phenomenon, but it can still exist and affect people's lives. Adjusting gender-affirming hormone dosage can better regulate this issue, but there are also additional concerns surrounding hormone treatment. Trans people additionally have decisions about fertility based on gender-affirming care. Some gender-diverse individuals, for many different reasons, decide to pursue options that completely prevent menstruation, including sterilization. Gender-diverse people who choose to become pregnant experience many of the same challenges as other pregnant people, but they also experience it in a world and society that views it as something women do. Others have choices to make about what period products they use that allow them to go through menstrual cycles with the least amount of dysphoria or discomfort as possible. There do exist apps on the market today that help people track menstrual cycles, moods, etc., that coincide with menstruating. However, the majority of them, and I'm not saying all because Sanicle exists and also people get in trouble with absolutes, are peak, emphasize feminine qualities, and use words describing body parts that can't be tailored towards a more gender-inclusive experience. These are seemingly surface issues, but they are important issues that exclude a whole community of people who menstruate and already have higher barriers to affirming care. Here is where I dream of hoping to be able to champion technology that allows anyone who menstruates to receive care. As we've touched on some of the challenges that trans and gender diverse individuals have accessing affirming communities and care, we can see the opportunities that we have to harness the power of technology to create a better world for each other. We can do that with our health care. We can include affirming gender care in our health benefits, which additionally signals that we are not inclusive in word only. We can get closer to equity in healthcare for our 2S LGBTQIA+ community. We can become even more inclusive of the issues that non-queer menstruating individuals have because we know what the challenges are of others. And in that, we can change the world for so many people. And Next, we are going to have Zakira Muhammad, my predecessor here at Sanicle, but most importantly, someone who has been very encouraging and welcoming. Zakira Muhammad is a TEDx speaker, brand strategist, and author. Her journey started with her battling childhood eye cancer while later becoming a survivor and a PCOS warrior. She has over a decade of professional experience as a branding specialist, empowering women to step outside their comfort zone, confidently telling their stories and challenge themselves. In addition, she is also a published author of Seeing Life Through a Different Lens, which delves into the importance of being true to oneself and finding one's purpose. She has been featured in podcasts and summits where she shares her insights and experiences in the field of branding and marketing.
Thank you, Ms. Al. Superwoman syndrome. It's been around for generations, despite officially being coined in 1984. Since the era of slavery, we, women-identified humans, have had to keep everything to ourselves. The NIH reports the Superwoman syndrome and mentions the societal pressure around women in all aspects of life, career, family, personal life. And so this phenomenon just so happens to be accompanied by feelings of guilt, fatigue, and burnout. The report then states the need for women to utilize self-care and realistic expectations of themselves to avoid the negative consequences of fulfilling unfulfilling expectations. And it also suggests that society should work together toward promoting a more balanced and equitable distribution of responsibilities between men and women. My name is Zakira Muhammad, and I am a PCOS warrior. Polycystic ovarian syndrome. It is one of the most common endocrine and metabolic disorders in premenopausal women, according to NIH. But let's rewind a little bit. I'm going to tell you a little bit about my story. Similar to Miss Deepa, who we heard earlier in the session, I was diagnosed at the age of 8, sought a second opinion at the age of 16, and a third opinion at the age of 30. PCOS affects 1 in 10 women globally and brings symptoms such as, but not limited to, irregular periods, phantom periods, weight gain, weight loss, deep voice, lots of hair, lots of acne, or nothing at all. All these symptoms not only impacted me physically, but it also takes an emotional, mental toll. My irregular cycle can contribute to insomnia and fatigue and severe cramps, and even heavy bleeding. My PCOS journey led me right here on this virtual stage to share my story, because I know that there are so many women out there who still don't have allies in their workplace. Now, how can we change that? How can we start to implement policies that support menstrual health in the workplace? Here are 4 or 5, depending on how you want to count it, tips to keep in mind. 1, each company should develop clear guidelines. Just like we have standards of operations and a policy handbook as soon as we enter a job, it needs to be put in to have menstrual health policies. This is adequate for ensuring that there's easily accessible and easy to understand tools for all employees, for both genders. This does include accommodation, flexibility of working from home, or just assuring that there will be privacy protected and there won't be any discrimination. The next thing is to take the time to educate and train the staff and employees. Have training sessions where those who are menstruating can actually take the time to educate HR professionals and vice versa. But the theme should be focused on empathy, understanding, and being accommodated. The policy should be reviewed and adapted. Let's say you're already at that phase where you're like, I already have a wellness benefits offer. Why do I need to change it? Because every menstrual cycle is very different. Every woman that comes into the company that bleeds is very different. So making sure to listen and communicate, making sure that this is being implemented and that feedback is actually being utilized in the policies at work. And most importantly, foster that inclusive culture. Just like we mentioned earlier, it's got to start with the bathroom. It's got to start with the environment. It's got to start with knowing that someone has that one person that they can talk to when it is that time of the month. And it's also important to continue to reiterate offering those diverse accommodations. Technology companies such as Nuvento, which is based in New Jersey, they have implemented the health policy leave, allowing employees up to 12 days of paid leave in a year, specifically for menstrual health. Another example is Chani, a Los Angeles-based astrology app that offers unlimited paid leave for the menstrual cycle. And there's no cap on when you can request that time off. These examples have definitely shown and proven to improve the productivity and the well-being of employees and the well-being at the workplace. And then these examples highlight how accommodations can be practical and impactful, contributing to a more inclusive and productive workplace. I remember the first day I had my period. I was with my childhood best friend, and suddenly there was blood everywhere. I was lucky because my mom was home and I could run to her for help. It was a simple announcement because my mom took the time to educate me on what's going to happen to my body at some point. While I understand that not everyone had that parental guidance, it's why it's important to have these conversations. When I was first diagnosed with polycystic ovarian syndrome, I was more worried about understanding my body than the fact that I could not necessarily have kids. And it started with that acknowledgement and awareness that just about every woman on this planet bleeds in one way or another at one point in a month or another. 28 days, that's why we wear the 28-day menstrual health bracelet. So my first question for you is, when is the last time you genuinely asked the woman in your life how they're doing and how you can support them? Why is the question even important? Because this is the first step to including comprehensive menstrual health accommodation at work. It's about acknowledging and supporting the needs of employees dealing with menstrual health issues. By doing so, companies can significantly improve job satisfaction, reduce absenteeism, and enhance productivity. An environment that prioritizes health and inclusivity and bolster a company's reputation, that's a win-win all across the board. Breaking the taboo starts with us. We got to start having those conversations and actively listening to each other. So let's recap. The ways to do that is to establish clear written guidelines for mental health policy, conduct training sessions for managers, HR personnel, and employees, and acknowledge the fact that individuals experience menstruation differently. Choose to become the ally at work. And if you stick around to the end of this session, you'll see a couple of videos, such as educating yourself by purchasing the Period Pack for book written by the genius Chase Young, and by looking to join a private community such as Sanicle's upcoming community, and even exploring more about the community partnership that has been created with Pangea. But for now, we're going to keep the conversation going. And I'm going to proceed over to the panel that's going to be moderated. And we're going to talk about prioritizing sexual health. Not many people want to do that. And it's super important. And before I introduce all the fellow panelists, I'm going to read this quote that the Tabitha Brown posted on May 14th. She said, "Women be out here experiencing periods, yeast infection, ovulation, cramps, pregnancy, fibroids, infertility, childbirth, stillbirth, postpartum, perimenopause, menopause, etc., all in the same year and sometimes in the same month or day, and still be showing up in life." This sexual health panel is going to be super insightful and honest. We are going to talk about why the workplace should prioritize it, why women should take their health and wellness seriously, and how it does impact both the workforce and at home. Our panelists are Drum roll. Let's start with Cordelia Gafer, the ultimate joy goddess and CEO of Cordelia Gafer Enterprises. She guides women on a transformative journey to intimacy with allowing them to normalize great sex. The result is shedding trauma and releasing negative experiences that have kept women playing small. And next, we're going to pull up Funmi, founder of Red Connect NG. And in addition to her 10 plus years in 10 plus year career in media, Funmi is deeply committed to public health advocacy. She leverages her experience in communication to focus on raising awareness about key public health issues. And as a sickle cell warrior herself, she empowers individuals to make informed decisions about their health and well-being. And last but not least, we are going to pull up Dr. Carmen McNeil, a facilitator, educator, and the creator of the Period of Empowerment Guide / movement. She dismantled the miseducation of menstruation, one community at a time. As a professor of psychology with a PhD in psychology, and while being a professor at school, she has the most expertise in mental wellness and social behavior. She had poured 2 decades, or maybe longer by now, of teaching and training others into the mission to equip women with the tools that they need to foster confidence and self-love as they experience critical moments in life. Welcome, ladies.
Hello. Thank you.
I want to drop the ball right there. As soon as you heard that Tabitha Brown quote, what went into your head? Whoever wants to go first. Next to my screen is Cordelia Gaither. And let's make sure everyone is unmuted and stays unmuted. There we go.
Thank you. My name is Cordelia Gafar. And the first thing that comes to mind is the disembodiment of each human, right? Because if we were connected to our bodies, there wouldn't be a question of honoring another body. So we have to begin there. You know, we live in these bodies for several decades, and yet we only honor and edify the brain. And proportionally, we're more body than we are brain.
That's a mic drop out there. Like I feel like she said everything that anyone else wanted to say. Dr. Carmen, you want to add to that?
Absolutely. Thank you. I think couple things that come to mind for me, and one is just the pervasiveness of the issues that you mentioned in the Tabitha Brown quote: cramps, pregnancy, fibroids, infertility, menopause, all of that. They're so pervasive, and how much they are part of our everyday lives. And so it really is a social injustice, feeling the need to have to leave these experiences at the door when you go to work. And so when we think about, social injustice, it can take many, many forms, including prejudgment, aka prejudice, and bias in social interactions. And work is a social place. And these social injustices, are really structural issues that are deeply embedded into societal norms. And so when we're talking about equity in the workplace, what we're talking about is that all employees receive the specific resources that they need to be productive in their jobs according to their unique needs. And so this is, some of the things that comes to mind from that Tabitha Brown quote. I'll pass it on over to Sister Funmi.
I would say it just stresses the point that you can't leave your personality at home when you go to work. Personality and professionalism work hand in hand. So I'm going to come to work with my period pain, my backache, my PCOS. I have PCOS as well, so I clearly understand how it is. I'm going to come to work with my mood swings. I'm going to come to work with aching breast for breastfeeding a child, or for my pains of a recent miscarriage, and still get the work done. And I just might not have a placard in front of my face that says this is what I'm going through, but this is what I'm going through. And the workplace should be aware of these things, hence this conversation. So she's just clearly emphasizing that we carry stuff. Where I'm from, there's a proverb that says that it means that what clothes cover is a lot. And that's what she's just saying. We cover up a lot with our clothes, but we still carry those stuff and we still carry day by day.
Every time someone finishes, let's just go ahead and snap because it's going to be too powerful. All right, I'm going to head back over to Dr. Carmen. And, you know, you are a professor, you are at school, you do work as well as, you know, do all the amazing things you do. But what are some of the challenges you've seen organizations face when it comes to integrating sexual health discussions in the workplace?
Yes, well, there are quite a few challenges. And so I think I'll just mention a couple of them, you know. So the big one, probably the primary challenge is stigma around sexual health, stigma around the female body, sensitivities around this. And so, you know, sexual health is often considered this sort of private, sensitive topic, leading to a lot of discomfort and stigma around discussions about it in the workplace. And then part of the problem with the stigma is the ignorance, meaning just lack of information, right? Not knowing basic bodily processes. It's amazing to me when I give lectures about this in terms of how much people who menstruate do not know about their bodies and how much people who do not menstruate do not know about the menstrual cycle. So that's one of the issues. And a couple of solutions to that is we have to normalize these conversations. We have to promote open, respectful dialogue through awareness, educational workshops, like some of the workshops that I facilitate, and helping people really have body positivity and understanding how the menstrual cycle is really just a guide for self-care. Leadership support, like you mentioned earlier, Zakir, really ensuring that leaders and managers openly support and participate in initiatives. And then the inclusive language, Michelle mentioned that earlier, being very, very mindful of how we are talking about this. Notice I'm saying people who menstruate and people who don't. I mean, that's very, very inclusive in terms of this particular experience. Another challenge is, like I mentioned, the lack of awareness and education. Employees and management might lack the knowledge about these issues, don't know how to address misconceptions, and so there's not enough support. There could also be employee resistance, you know, because of that stigma, because of the ignorance. Some employees might resist or be indifferent to sexual health discussions, you know, viewing them as irrelevant or intrusive. And the solution to that is really about involving employees in the planning and implementation of those initiatives and the policies so they can see how it meets the needs of the menstruating workforce. There are 1.8 billion people on the planet who are menstruating. So a portion of that is a huge part of the workforce. But then it also benefits the company as well, like some of the benefits you've talked about already. So those are just some of the challenges when it comes to integrating discussions into workplace culture.
So now I'm moving this question over to Cordelia. And speaking of employee resistance, what are some of the common misconceptions in the sexual health workplace, and how can we debunk them?
Yeah, I would have to just really piggyback off of what Dr. Carmen was saying. I believe that we need to detoxify the conversation around sexuality in the workplace. I mean, let's just be honest. It's not funny to be sarcastic or to make jokes about objectifying women. And that is so commonplace and so widely accepted. And I would say, let's begin with education. I agree. And I will give you some resources. There's a book that was written by Dr. Christine Northrup, probably it's been about 2 decades, Women's Wisdom, Women's Bodies, or Women's Bodies, Women's Wisdom. The first part is, and I'm just going to read you some of these titles. I think this first part should be required reading for all leadership, and this will help in educating women as well. The patriarchal myth, the origin of mind, body, spirit, emotion split. Yeah, there's no such thing. We're fully integrated whole humans. And then the second chapter is feminine intelligence and a new mode of healing, which again talks about the beauty and the nuances and the wisdom that comes forth in the different cycles of different parts of the menstrual cycle. And then inner guidance and the female energy system, right? So personally, what I experienced when I was a CFO at a tech company, and a lot of the discussion today has been around male-dominated industries, is although, right, I was out on maternity leave, and in this case, it was with my first child, and the company policy was 8 weeks. On the 6th week, for some reason, I got a call. Are you going to ever come back to work? And I said, the agreement is that I'll be there after 8 weeks. I'll see you then. And sadly, my oldest is 24 years old. And I understand the story is still the same. And so I don't think we need more policing of women. I think we need less policies and more education of what it is to be a human, and look at the way we are being at home with our female relatives, because you can't be different when you show up at work. And so I'm looking at this a little bit different, like outside of the box. I know we're here talking about how to make better policies and how to make better laws. Yeah, so that's been working super well. And since it's working so well, I say just throw them out and let's just go back to being fully embodied and get rid of the old colonized, imperialistic, misogynistic slavery mindset that we have, because our corporations are the extension of slavery, right? That most people don't understand or recognize, that there were corporations that were benefiting from slavery. So let's just bring that conversation to the light.
Now, for me, this is also technically for everyone, but I do want to kind of piggyback on what Cordelia talked about, just really sharing a personal story where sexual health led to positive changes in an environment.
So when I realized that I had PCOS and I had a couple of issues at work, I was trying for a second child. And I went through all the tests you can think of. Do this test, that's examination. And first of all, diagnosing PCOS was first of all a problem. Okay. But we finally got to that point where we could diagnose it. And then I had mood swings, I had reactions and bloating and inpatience. And it is so, people were so quick to call you emotional. So I think we need to strike that. Everything. And if you do check studies, all due respect to the men are more emotional than women. Because if we were to swap roles, women are built to be multi-dimensional. We have the ability to handle multiple things at the same time. Men are built to be logical. They handle one per time. If I put you in my role as a woman, your emotions will let go. So if I'm able to handle my day-to-day, it should not be considered as emotional. Or they just throw it in there just to cut you by the wing and level you up. Oh, don't be so emotional. No, it's not about emotions. It's about the way that my body is built. It's about the composition of my genes and my hormones and my versus and everything put together. That's how the biology of my body is. So we had to come to a point where you realize that if you consider health in the workplace, make it accommodating to everybody, it's to the benefit of the workplace. Because when I come to work, and studies have shown that females are more loyal, are more giving, are more productive in the workplace, do more research, bring about more productivity. They just don't get the announcement like the male counterparts do. You will have females working in the same place for 26, 30 years straight, giving their best every day, all day, every day. But the moment there's an opportunity for a promotion, because she is built for growth, she's not looking for profit, first of all. She's looking for growth. We have to be consciously taught to say, okay, you've given so much. What's there for you? Start asking for things for yourself. We're just thriving and happy that everything is moving on well together. So if you can reward that productivity, it's not just to the benefit of the person, it's to the benefit of the entire organization. Because in return, you're going to get improved employee satisfaction. You're going to get retention, which is a major problem in the workplace now, because everybody's hopping 2 years, they're here, the next 2 years, they're out. You get retention in the workplace. You will get more productivity. You will enhance productivity because you give the people a sense of belonging, to realize that this is not the company I just work in, it's a company that we work in. So when I started off Red Connect, I was looking for a name, and I found Red Connect because we have different colors of skin, we have different personalities, we have different sexual needs, but we have one thing in common, and that's the color of our blood. No matter who you are, where you're from, what your preference is, the color of your blood is red. So we are connected that way. Hence the word Red Connect. We are connected by blood. When you are dying on your bed, you do not care if your doctor, if your nurse is from Puerto Rico, is from Zambia, is from, can this person help me out of this position, is what you care for at that time. So you realize that health doesn't have to be COPD or heart disease. Sexual health is also a connection to us all. Sexual health brings about mental balance, brings about mental health balance in the workplace as well. So if we can incorporate that thing, it's funny when you get into a new job, they make you watch all these videos from HR, sexual harassment, and what you should do. Those videos should be swapped to sexual teaching. Don't just focus on the problem. That's the problem. You keep emphasizing the problem. Start emphasizing the solution. How should you act to another person who doesn't look at you in the workplace? How should you respond to a compliment that you do not understand? How is the tone of voice interpreted that it is not taken out of context? How are mood swings handled in the workplace? Do we have a venting room? Do we have a meditation room? Do we have a quiet room that people can take a moment or two and just be? Do we have a pain room where the pain might not be physical, it just might be you need a moment to scream and just go in there and come out? Do we have those things to accommodate people? But we have HR policies, and when you make a mistake, everybody brings out the big book of judgment against you. But we need to turn those policies now into teaching because the benefits are enormous.
And now for the last question, before we do open up the floor to anyone else who has questions, I want to bring this question around back over to Dr. Carmen and Cordelia on how can we improve employee retention and satisfaction in workplace culture? In one sentence, what can be done?
Should I go first?
Yes, Carmen, go ahead.
Okay. So lots of the things that we've been talking about already, normalizing the conversations. And I love what Sister Cordelia said about taking a look at how you are interacting with the people who menstruate in your personal life. Having some conversations with them first. Talk to your romantic partner if that fits, or your daughter or your sister or your cousin, whatever. Have those conversations about their experiences, because many people who don't menstruate have no clue about what those experiences are and all the things we're holding, like in the Tabitha Brown quote, like they are they're oblivious. They really, really have no clue. I'm not saying all, but I'm saying a lot do not really understand the magnitude of what it is that we're holding. Again, training the leadership team at work, training the leadership team, the management team, everybody needs to be on board. And then perhaps even having as a part of your wellness program, at work, your corporate wellness program, bringing in workshops like I have one entitled Rock with Your Menstrual Rhythm that is for everybody. It is inclusive so that everybody understands the 4 phases of the cycle. It's more than you're just bleeding or you're not. There's more than that going on. And dropping those seeds, of positivity, having sex training, as Sister Fumi mentioned, right? So the education needs to be there, and it needs to be built into the corporate culture. And so, these are some of the things that we can do. But I am very, very clear that when people take an inventory or an assessment of their personal lives, it can really help guide how we bring it into the world of work, because there's a strong workforce out there who are menstruating and definitely are in need of support. So I'll turn it over to Sister Cordelia.
Thank you, Dr. Carmen. I resonate also with your point about wellness. Like if there is a policy to look at, it would be the wellness policies that companies offer. I love Fumi's idea about the wellness room extending to a pain room, right? Yeah, sometimes we just need to scream or throw things. So instead of having to go to a place where you throw axes, what if we had that at work? How cool would that be? And the other thing is we're talking a lot about sexual education. One thing that we overstep in that is consent education, right? So I talk a lot about sexuality and what is multi-orgasmic living. It is about respect and consent. And consent is more than yes and no. It is understanding the requirements. It's being clear on the limits of an individual and reconfirming that those limits are not being overstepped, being an advocate for what it is that you require, and being empowered to advocate for what it is that you require. And so I think we need to, again, instead of talking about the problem, right? Let's be solution oriented. That is when I talk about feminine intelligence, we're solution creators, right? We're not solution seekers. We are the creators of that because we all understand here that women are multidimensional. And so and of course the leadership team needs to be really well versed on consent. So that's one of the trainings that I offer.
I'll go back to the first thing I said about personality and professionalism. So I'll talk to the worker now. Bring your personality to work. When accompanied with the respect, the feelings, the regards that you have for the women in your life. Bring them in your mind to work. So that gives you extra work to do. So when you're at home, pay attention to how the females in your life feel when they're on their menstrual period. Menstrual period is just the outflow of blood. Some people have diarrhea. Some people have GI upset. Some people cannot eat certain foods. Some people cannot move. Some people get hospitalized. Just because you might have a strong woman at home doesn't mean that everybody walking around is strong. So bring a bit of your home to work. And also bring some kindness. Be kind. So I'm from a background where I may not understand the LGBTQ community. It's not how I was fashioned, but I do understand humanity. I understand respect. I understand choice. I understand love. And that's all I need to understand. It doesn't take that much. The same way you translate it to work. whereby you do see people, you need also to enhance and bring that kindness to it and bring that understanding of just this person is human. And for that reason, I need to respect them. And that's it. That's all we need to do. It's that simple. It's not complicated. You need to take a Harvard course about it. Just be kind. It's that simple.
All right. Thank you for the amazing, powerful conversation. And then I'm going to read out loud the question. I think this is a question directly for me, and then we'll be wrapping up. Okay, so talk more about the work that you do at your home in Nigeria.
Oh, so I do have a master's in public health, and I decided to combine that with my whole communication skills and educate my people back home about the basic things regarding health. We wrapped up a health drive back home where we help people discover their blood pressure and blood glucose and how to check those things and signs and symptoms, because you might not be able to call 911, but there's certain things you can do at home in order to check your basic health and then prevent certain emergencies from happening, or get a grip of those emergencies before they happen. So we started the first Bola Eco health drive back home. We have the next edition happening at the end of June, and we're going to do it bi-monthly and get people educated. And then we've got people on board who have helped, also offered to volunteer with us to make sure they have blood sugar test taken, HNC test taken, and then also follow up with some medication. We've got some people on board to give free medication as well. Just getting people healthy any way we can, with the little way we can, and making it a better place. That's what we do. Right. And yes, menstrual health is part of it as well. It's on the list of the things that we will be championing. We do 3 months of the high blood pressure. Then our next phase is sickle cell, and then the next phase will be menstrual health. Yeah.
Great. Well, you can definitely Google for me and reach out to her on social media to interact and donate and be a part and be of service. And same thing for period of empowerment. Always looking for collaborations of fellow period sister warriors, and as well, all of us are here to partner, so be sure to engage with us on social media. And now we are turning it over to the final part of this amazing summit. Thank you, Aya.
Thank you all so much. We're almost done, but we do have a couple of videos we'd love to have you watch. So those should play here in just a moment.
You know you was gonna do that.